gathering where brilliant minds, young scholars, and global innovators come together to share insights, exchange perspectives, and build meaningful academic collaboration. Today's symposium is not only a platform for academic discourse, but also a celebration of diversity, intellectual curiosity, and international partnership. We hope that every session, presentation, and discussion will inspire new ideas, strengthen global networks, and empower our students to become future leaders in their respective fields. On behalf of the organizing committee, I extend my sincere appreciation to all speakers, participants, and partners who have contributed to the realization of this important event. Thank you for your presence and enthusiasm in making this symposium truly international in both spirit and impact. Once again, welcome to the International Nursing Student Symposium, and I wish you a productive and enriching experience throughout today's program. Before we begin, we kindly remind all participants to mute or set your mobile phones to silent mode to ensure the program runs smoothly without interruption. We also ask all participants to maintain cleanliness and order through the event. Please keep the venue tidy and dispose of any waste properly. Thank you for your cooperation. Ladies and gentlemen, we kindly invite you to stand for the singing of the Indonesian national anthem, Indonesia Raya, and Stikel PPNI Jawa Barat March.
Lagu apa nih? Lagu Indon tuh.
Thank you. Please be seated. So officially open today's program, we are enrolled to hear the welcoming remarks from Mrs. Eva Suprihatin, PhD, representing chairperson of the Stikap PPNI Jawa Barat. Mom, the floor is yours.
Thank you for the opportunity. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Peace and blessing to all of us. I'm sorry, Miss Lilin Indayani, she cannot attend for this morning because she has a duty to Makassar. Okay, I will read his speech for today. Distinguished keynote speaker, honorable professors, lecturer, researcher, and nursing student from Indonesia and around the world. Ladies and gentlemen, it is a great honor and privilege to welcome you to the 2025 International Nursing Student Symposium hosted by STIKA PPNI Jawa Barat with the theme Future Reading Nursing Student Caring Skills, Technology Skills, and Life Skills. Today marks an extraordinary gathering where brilliant minds, passionate educator, resilient student, and global expert unite with one shared purpose to save the future of nursing. As we stand at the dawn of a new era in healthcare, we recognize that the role of a nurse is evolving more rapidly than ever before. Artificial intelligence, robotic assistant care, virtual reality simulation, telehealth, and data-driven decision-making are no longer concepts of tomorrow. They are the reality of today. But alongside technological advancement lies a timeless truth. Great nurses are built not only by skill of the hand and intelligence of the mind, but the compassion of the heart. That is why this symposium places strong emphasis on three essential pillars. The first, caring skill. Our commitment to empathy, communication, and human connection. The second, technology skill. Our readiness to embrace innovation and digital transformation. And third, life skill, resilience, adaptability, collaboration, leadership, and global citizenship. These elements are not separate. They are inseparable. Together, they define what it means to be future-ready nurses who lead change, not follow it. We are honored to be joined by distinguished speakers from Taiwan, Malaysia, Australia, the Philippines, Thailand, and Indonesia, who will share invaluable insight, experience, and innovation. Your present amplifies our vision of building a strong global nursing community that learns, collaborates, and grows without borders. To our students, today is your moment. Be curious, behold, ask questions, challenge assumption, and believe that you are the generation who will change the world. The future of healthcare needs your courage, creativity, and compassion. To all partner, collaborator, and our dedicated organizing committee, the success of this event is a reflection on your work, passion, and unwavering commitment. We express our deep appreciation. May this forum spark new ideas, create meaningful friendship, and open powerful opportunity for global collaboration. Ladies and gentlemen, welcome to the 2025 International Nursing Student Symposium. Let us celebrate knowledge, champion innovation, and step confidently into the future together. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Mrs. Eva Suprihatin, PhD, for your inspiring words. Ladies and gentlemen, our next agenda is the first lecture session by Professor Wang Chijing. With the topic her lecture is ergonomic practice in nursing care, hands-on strategies for safe and compassionate work. Session would like to be great by India. I would like to read her curriculum vitae. Anandia Dianira. She is graduated from SMAN 6 Bandung and is a new student at Stikep PPNI Jawa Barat with a strong interest in public speaking, ready to pursue a passion in the new environment of college life. Her achievement in 2022 being participated in the Barokah Festival Committee. In 2023, being participated in the Wings O Wings Choir competition. For my beloved friend Anindia, the floor is yours.
Thank you so much for the Master of Ceremony for giving me the floor and chance to continue with the next part of the program. Good morning. Assalamualaikum warahmatullahi wabarakatuh. Salam, Om Swastiastu, Namo Buddhaya, and greetings of virtue, peace be upon of us. Dear guests, respected speaker, and all participants, welcome to the International Nursing Students Symposium. First of all, let's give thanks to Allah Subhanahu wa Ta'ala for allowing us to gather here today in a good health. My name is Anindya Deanira Putri, and I will be your moderator for today. I will lead this session and make sure everything runs smoothly. Let me start by introducing our speaker here, Ms. Professor Wang Jijing from National Cheng Kung University, Taiwan, as our speaker for today. Now, allow me to read the curriculum vitae of Professor Wang Jijing. Professor Wang Jijing, a professor and PhD holder from the National Changhua University of Education, Taiwan. Her academic and professional expertise covers a wide range of fields, including community health nursing, epidemiology, the assessment and care for physical and psychological impairments, as well as research on health behavior, health promotion strategy, and community empowerment. Professor Wang also has an impressive research. She has published several notable studies, including research on ergonomic training program for work-related musculoskeletal disorder among hemodialysis in a randomized controlled trial at 2024. Studies on work-related flow and correlates among frontline nurses during the COVID-19 pandemic at 2024, research on barriers to physical activity among female nursing students within social cultural norms in Indonesia. Now, without any further ado, let's start to our first session of presentation with the theme Agronomic Practice in Nursing Care, Hands-on Strategy for Safe and Compassionate Work. Please give your full attention and applause to welcoming Professor Wang Jijing. Good morning, Professor.
Yeah, good morning. Selamat pagi. Selamat, how to say that? Thank you. Appreciate.
Terima kasih.
Oh,
Terima kasih.
oh, yeah. Terima kasih. Sama-sama.
How are you today, Professor?
Yeah, I'm feel good and I'm so great. I'm so amazing for our student. Everyone's so smart. Right? You are smart? Oh, good. Give us up, okay?
How are you feeling to be here again today?
Yeah, I'm feel very pressure. Yeah, it's yesterday, especially yesterday is our school opened the master program,
Yes,
right?
right.
If you want to promote your career, please stay here. Continue, okay?
Okay.
Our faculty is so excellent.
Okay. Are you ready for today's presentation, Professor?
Yeah.
Okay. Your presentation is for 45 minutes. The floor
Yes.
is yours, ma'am.
Yeah. I control my time. Under less than this duration. Yeah. Okay. Firstly, I feel very happy and honored. Yeah, I can share my one of the study ergonomy risk. Uh, before uh, before I next please next slide. Before I start my sharing today topic, I especially need to let you know my career. Yeah, from the 2016 to to the 2025, my research career very wildly, including the community health, school health, occupational health. Yeah, especially near 5 years, I tried the AI intelligent digital nurse, yeah, median, including in my research. And we want to help who? Nurse. Yeah, on the beside the clinics can help them do the very well the practice and take care of our patient, right? Yeah, another one I also please next. In past 5 years, applying intelligent technology in my primary focus, enhance health assessment, management. Could I have the pointer? No? Oh, sorry, sorry. Yeah, it's okay. Yeah, the first one, during the COVID-19, I developed one app and can help the student learn how to protect themselves and also publish this topic on the top one journal. Yeah, the other one, I also developed the mobile-based app to promote the student their physical activity. Yeah, this app we together with our graduate student. He has graduated. Please, Dr. Kowa, stand up. See everyone. Yeah, he is a smart. Yeah, I think the he can share so many strategy and related knowledge to you. Another one, I also developed like the ergonomic risk assessment, apply AI, machine learning, this deep learning, this kind of the strategy. This is a very tough of the knowledge and the skill so far. Now it's AI generation, right? Yeah, so you don't need to learn how to write a program, but you need to know how to design and translate our idea, discuss with the who engineer, informatic engineer, let them comes through our idea and apply on the website or AI or apply this skill to help our nurse on the clinic setting. Another one, I also developed one kind of the interactive digital learning system, yeah, for NG feeding. Yeah, because NG feeding is a very high tech, a little bit high tech for the student, and they also need to learn how to do and how to care. So I developed this kind of the uh, digital learning medium help students before they go to the clinics, before they go to the class, and they can learn from the website. Another one in Taiwan, we are a high age, very so many amount of the elderly population, the prevalence rate over. Okay, thank you. Yeah, so I especially developed the interactive in Nurse One. You can interact with this media to learn how to handling the skill and the practice, protect your low back, protect your neck. So this is my related uh, career. So thank you. Then next is mine. I can control it. I cannot control. Okay, next. So I need to introduce for the ergonomic. Yeah. Why this is so important matter for the nurse? Why? Because nurse need to face high rate of the musculoskeletal disorder (MSD) and burnout. Our student, when you stay in the practicum, do you feel burn out? No. Wonderful. It means what? Our faculty is wonderful. Yeah, that you can learn from the, but maybe your generation, your grade not yet go to the hospital practicum, right? Have you stayed there? Oh, really? This area is a high grade. So you have stayed. Yeah, okay, good. Do you feel burnt out when you take care of the patient? Yeah, okay. So you can see, oh, for them, they come from with the MSD and especially low back and neck pain arrive at 80%. So protective nurse health ensure sustainable high quality patient care. Next, I want to let you know healthy nurse equal to safe patient. So you are health and your patient is safe. Next, a healthy nurse is the foundation of the healthy hospital, right? So hospital is recruit you. Most of the nurse occupy the manpower of the hospital. So you are very important. Are you important? Oh, good. Next. So who knows what is ergonomic? Raise your hand. Let me know who knows that. Have you ever heard about this terminology? No, okay, never mind. Yeah, this is a very special uh, professional knowledge. Let me tell you, ergonomic is the science of the design work environment, task, and the tool to fit the worker, improve the worker health, safety, comfort, and the performance. So focus on the interaction between people, equipment, and system. So if in the future, who wants to still stay in the clinics and as a nurse, raise your hand. Only one. So others, you don't like to be a nurse in the future? Oh, your faculty will feel upset. Okay, like I ask you, yeah, when you have practicum stay in the hospital, who take care nurse health? Who? Nurse take care patient, right? But who take care their health? Who? No, you work for your boss. They pay money to you even though they pay money to you. But who take care of you? Yeah, right. Your faculty has a correct idea. Hospital, your boss need to take care of you because you make money for them. Understand? Yeah. So you instead of them to take care of patient, right? And they need to take care of you. Remember, this is your right. Okay. So they need provide a very wonderful available equipment to protect you. Okay. Next. So nursing is one of the most physical demanding professions. Do you feel agree that? Nursing is a physical. Why? Physical demanding. You need to change position for patient. Do you know how to do the correct posture to take care of your nursing skill? Do you know? Okay. So high risk every day. Consequence is maybe pain. Yeah. So like this. So when nurse are safe, patient are safer. Agree this? You don't agree? Oh, yeah, agree. Need to agree, right? Okay. So you need to protect yourself. Okay. Now, next. So why human factor so important? Yeah, because in nursing task, it linked to safety and the injury prevention. So human factor engineer helps us to design the workflow and the environment that reduce error and injury, enhance both nurse and patient safety. Understand? If you use the one kinds of the care device, yeah, and use that frequently, it's not available to put it down on the ground, right? You need to do this kind of the a very loading posture. Yeah, it will let you feel discomfort. You have another more energy to take care of patient, right? Agree? Yes. Next. So you can see our nurse so busy. We make money for hospital. Agree? And take care of the patient, even though patient pay their money. So we need to provide a good quality to them. So we make money for our hospital. So hospital also need provide a wonderful environment to help us. After, if we save, patient is safer, right? Next. So you can see why ergonomic assessment is so important. Yeah, because a physical demanding profession, manual patient handling, repositioning, lifting, and transferring, long shift and high work pace, and repeated task and a work static posture. You can see you turn over, change position for patient. You need to pay so much effort on your low back. So if you have not a good skill, yeah, it will strengthen your muscular sclerosis. Yeah, so ergonomic assessment equal essential for injury prevention and the workforce sustainability. Next. So who do it? In hospital, who instead of your boss to protect you and assess you, who? Do you know in my country, this nursing law is very important. Yeah, if they did not hire one group, occupational health nurses, they need to be punished, pay the money to government because they did not frame a good environment to protect our nurse. So who protect you? This team is an occupational health nurse. So they need to create, this is an international journal of nursing study, our top one journal in nursing, right? Yeah. Publish fee is very expensive. Update on occupational health nursing through, 21st century requirement. The first one is create a healthy and safe workplace. So that is one of the role. We need to create a new role for our nursing career, not only take care in the hospital. We can work in school, right? So have a school nurse. Community, so we have a community nurse, right? And we have a nurse in hospital, but we also need this role to take care of ourselves. So that is occupational health nurse. In American or in Japan, they need have a master level. Yeah, after that, because related to this kind of knowledge is a high tech, high level. Like in Japan, their school nurse need graduate from the master program. Yeah, you know, in nursing school, very, very high loading. They need to have a so wonderful and knowledgeable for their professional skill and technology to take care of our student, our teacher, our who, their parents. Okay, next. So they do what? They need to specify by expert occupational injury, and they need to know this kind of the knowledge. They also need to know the legislation, occupational health and the safety legislation. In Taiwan, we have the legislation to request their boss in not only hospital, including company, they need to obey this regulation. Do what? Risk assessment for the worker and treat them. So, also doctor, physician, also have occupational health physician. Have you ever heard this kind of the job? No, it's all right. So maybe our people need to request our government, protect ourselves, right? Yeah. Okay. So risk assessment, occupational health nurse need to know health education every day. You do that, but they need to create a health education for you. Okay. Next. So you can see conducting ergonomy assessment is a foundation. Yeah, that is empower occupational health nurse with the ergonomy assessment skill. Yeah, so need to competence that occupational health nurses must to acquire early on. So they need to learn how to assess your health, including your ergonomy risk. In Taiwan, we have the 4 tasks they need to obey every year, at least more than 4 times by season. The first one is ergonomy risk assessment and modify your working environment. Yeah, including in hospital, in company. Yeah, if they did not do that, our government will punish the boss, not not for the nurse. Yeah, punishment the boss. Yeah, so and then they will recheck again if they did not do, punish again. Do you feel this regulation is good or not? Understand what I mean? Okay, never mind. Like next. So you see the role of occupational health nurses on management ergonomy risk for the clinical worker. Yeah, they do this, assess the workplace and the working posture, implementing solution to you, and educating staff for you, and monitor your effectiveness of the intervention. They need to create the project treatment for you. Okay, so next. How to assess? So many kinds of the instrument can help occupational health nurse to do that. One, physical measurement, posture, and analyze. That is the objective. The other one is psychosocial perceptual measure. That's a self-report. Environment factor, they also need to go to the field to do and assess your working environment is okay or not. Yeah, so how to do? Through the 3 way to do that. Yeah, this is one kind of the physical measurement post analysis. Next. Yeah, so including, this is the observational measure. The first one, what I talked about last one PowerPoint, including whole body checklist, upper limb checklist, task-based checklist, environment forecast, and including a self-report, right? Next. Next. Yeah, you see so many kinds of the checklist. One is the REBA, another one RURA, OWASP. Oh, you didn't know this, it's okay. Yeah, because that is not your job, but occupational health nurse need to know. So if someone wants to promote as an occupational health nurse, please promote your education level as a PhD. Yeah, it need to. Do you want to? Oh, good. Wow, so wonderful. Great. So great, our student, right? Next. But the other one is a conventional method, self-report by them. So they occupational health nurse give you the checklist by yourself and answer the question next. But limited of an observational method because limited observed time, subjective posture interpretation, yeah, human bias for the observation, inconsistent worker feedback, difficult translating result, challenge for the long-term observation. Yeah, my worker is not so well. You can see if they want to assess listeners do something on the table, and they need to use this checklist, and one occupational health stand here, another one stand there. So through they need to use the video, take them and record their job process. After that, they carry the video record and back to the station, do the analysis. This is a human do that like next. So you can see what kinds of the technology can help us. You know, occupational health nurse, they need to take so much time to do that. Yeah, and also including have a human bias. Yeah, because your observation different from mine. Yeah, so who can help us? Smart technologies that reduce observation bias in posture assessment. So many kinds of the measurement smart technology can help. Looks like this kind wearable, they well and know their action. The other one, you see, yeah, pass on here, know their angle. Yeah, so work ergonomic risk one can measure your whole body like this. This is not a good posture. If you, during your working process, you need to use this kind of the posture, incorrect. You only can do one day. After that, oh my God, my low back so pain, right? Understand? Yeah. Next. But if they, sorry, never mind. Like, if when you during your work on here and you would like to carry test on this kind of the IC, no, it's very fear trouble, right? And sometimes we lose. So next, so many kinds of the just like this, you can see, yeah, it's an incorrect posture. That is my one of the measurement tool. We use the camera and the record their working process and the working posture. AI driving, ergonomic analytical next. So you see, I and my research team, we can imply open pose. Have you ever heard about this AI technology, open pose? No. Do you know your they can train your walking step or any kind including the walking posture. They will define your walking step is right or not. They also apply this for our elderly if they are struck, because stroke, their walking step is not stable. Yeah, after you give them intervention, how do you know your intervention is effective? You can apply this open pose to know they can work very well, right? Okay, so this is one of the technology to help us next. So we imply this to publish, use the machine learning approach. Machine learning is AI technology. Understand? Yeah. So AI is a technology need to write the programming. Have you ever heard about the Java C language? No, that is not our specialty. Okay, because I found our nurse has the incorrect posture, so I design one thinking and cooperate with our engineer programming, and they discuss about comes through my idea, research idea, and know how to assess the working posture in swimming. Now, because our nurse, your job process is very complex. Sometimes you need to do the IV dripping. Do you know if you lift your hand, it is not a good variable. Yeah, over maybe 1 minute, 2 minutes, right? And you need to change position. So our job is very, very complex. How do I do so? Firstly, I apply another one who uh, they are sewing job. I from sewing job machine to try my project firstly. After they can do well, I apply my nurse. So now I have applied for the dentist because dentist only seek the chair treatment for your dental, right? Okay, next. Yeah, so we apply the machine learning to avoid the subjectivity and to decrease occupational health nurse their working load. So why your uh, uh, the teacher they say that AI can help you do many things. Next, yeah, compared to the traditional, we apply the AI can correct so a huge amount. Do you have ever big data? Have you ever heard about the big data? Big data including maybe 100,000 over or thousands data. After that, looks like the ChatGPT because every day, do you use ChatGPT? Raise your hand. Oh, ChatGPT is our good friends, right? Including faculty assignment to you. You can ask Google ChatGPT. ChatGPT is my God. Oh, ChatGPT is my first husband. I every day make friends with her, with it. No, it's just a kidding. Yeah, okay. I cross with a ChatGPT also. Yeah, okay. Next. So you can see, yeah, we use the videography and the text record them, and also use the REBA apply in the programming, yeah, to analyze. Next. Yeah, so videograph is very important in working posture. We firstly we record them and pay for this data to the AI. Understand? Not to the human, not to the occupational health nurse, to the AI. And only 50 minutes like next. I want to let you see, you can see. Yeah, use the open pose can know their posture is okay or not. Right, next. Yeah, so we use the computer vision based method for human pose. Next. Yeah, you can see only 50 minutes. You got big data. Only 50 minutes. If you collect data in the community or your bedside, you can collect how many? Let me know. In 1 month, you can collect how many numbers of your subject. Can you correct so many? No, impossible. Yeah, maybe you need to cook 10 years, right? Yeah, so yeah, machine learning can help you. Yeah, only 15 minutes record. AI can analyze the posture. Yeah, okay, next. So machine learning help us very wonderful and the model output that you know where is something wrong next. So you can see they also apply in the operation room. Yeah, because the physician, they stand there and a very long time to do the operation. Yeah, it's also damage their low back next. Yeah, so also we apply in the exercise. Yeah, if you do the wrong exercise, maybe damage your posture. Yeah, also got the ergonomic risk, musculoskeletal disorder. So we also apply this AI open pulse on the nurse when they do the intervention. Right, okay, next. So you see now AI or digital in patient movement, we don't need to change position for them. Yeah, passive is very damaged patient, yeah, they are physical, right? Muscle power. So now they design for this AI. Okay, next. Okay, so another one, we design the ergonomic training for the nurse is a very wonderful outcome. I think the time is up, right? That how long?
Wait a second, Professor.
Okay, if time is up, we stop it here.
No, you can continue.
10 minutes?
Still a lot of time. You can continue.
Okay, right. Yesterday, I also shared this study. This study also published in the Journal of Safety Research. Yeah, this is especially for the ergonomic. This kind of the study, SSCI impact factor very high, and the top two in public health ranking. Next. Yeah, we through the environment, the first one assess their personal working posture and empower environment, and assess the ergonomic risk how high, and design the intervention program and implement. Last one is evaluation. Next. Yeah, we stand by backside and to see the nurse how damage their posture. You can see they need to lift hand. Yeah, this action so damage your shoulder. Yeah, you can see they need to change position for patient. They need to on the ground to lift very low way, very loaded for the liquid. Yeah, do the process. So everyone working posture is damaged their muscle skeletal. Okay, next. So after that, we designed 12 ergonomic training program, and also we give them one lecture to tell the nurse what is ergonomic risk, how to do the correct the posture, and your walking posture, what is a risk, and how to carry, how to lifting and carrying the technique. And also the 60 minutes lesson, training them their exercise. After that, they themselves do the 12 at home, because nurse very busy every day, right? Very busy. So they take home, but their compliance is how much. We use the line application, mobile application to monitor them. Next. So you see, now everyone, could you, yeah, do this kind of the exercise? Like me. Do you feel here is pain? Ergonomic risk. And then another one side. Which one side is more painful? Which one? Right side. So you use computer and the mobile too much, right? And another one, who yesterday our faculty is wonderful. Like coming. Your hand, like our faculty. Like do it. Can you? Can you do it? Cannot or can. If you cannot touch, it means what? It means what? Your portion not like our faculty is so good. Understand? So we teach them how to do. You can every day do this.
Boleh diikutin ya untuk teman-teman.
Yeah. Our students so smart. Yeah, next. Woo. Yeah, next. So can you do this? Can you do this? Okay, do this. Like this. Do this. Yeah. This and yeah, and the leg. Release your wrist. Yeah. Do you feel pain? No. Oh, wonderful. Yeah. Another one is also need to open and close. Open and close. Yeah. Okay, next. So future direction also, yeah, please AI help us, right? AI and variable integration, interpretation, collaboration, job analysis, very important. Future research can focus on the predictive AI, scaling variable for this kind. So that is one of our research topic. Also, faculty can bring our students get together to do. Yeah, okay, next. Okay, thank you. I think that our topic is stop at here. Don't over too much. Yeah, because they sit too long. Yeah. Wait a moment. I give one exercise. Please stand up. Do you feel pain? Yeah. Is it there? Not once. Yeah. Yeah. It can that your hair is beautiful than our girl. This side can beautiful. You give it. Please sit down. Thank you for your listening. Wow, everyone feels so exciting.
Okay, thank you so much for Professor TJ for the great presentation about agronomic practice for safe and smarter care. Okay, allow me to read the conclusion of the presentation. Agronomic is the science of designing work environment, tasks, and tools. Nursing is one of the most commanding profession and it's important to apply the agronomic human assessment because it linked to safety and injury prevention. Also, healthy nurse is the foundation of the healthy hospital.
Yeah, yes.
Please give an applause to Professor TJ.
Thank you. Thank you. I can see so many movie star in here. What's the movie star? Nursing expert. Are you will be a nursing expert? Oh, good. Good, so good. Yeah, our students, so great.
Okay, now we will begin the question and answer session for 5 minutes.
Yeah.
If you have any question, please raise your hand or for those who Zoom online to type the question on the chat. Okay.
Oh, I see you. I forecast you.
Okay, let me introduce myself. My name is Angeli Rahmadani. You
Oh,
can call me Angel. I'm from Budi Luhur Institute of Health Sciences, Cimahi.
Oh.
I really amazed for your presentation, and then I also have two questions for you. May I?
Yes.
Yes. For the first question is, I ever had hospital duty, and I had experienced several times that after night shifts, I have to continue morning shifts. So it's over limit of duty, right? But the fact is in Indonesia, it's normal in Indonesia. A lot of nurses who had double shifts in a day or 2 days. It's normal in Indonesia.
Oh.
So how do you think about it, Prof? And then the second question is, based on your material, for the observations ergonomic risk of nursing are using technology. But maybe you have to know that in Indonesia, technology and internet for access, it's still not evenly distributed in remote areas. So how to solve it? How to do observation and monitoring of ergonomic risks for nurses who work in remote areas because they still need to be healthy, right? Thank you.
Thank you. Give her palm. I really admire your name is so sweet and beautiful. Yeah, first one. Second, I'm so amazing. You can ask so great and so big, huge question. It's not easy to answer, but I possible to answer you. You know, in American, maybe not match with your needs, the question to answer you, but according to my in uh, in Taiwan also not so very wonderful the environment in the hospital, but in American they have the 1 hour or 2 hour tea times. Do you know? They can quit from the fear and to the rest room and sleep or drink anything. Also have a lunchtime 1 hour. Yeah, but in Indonesia have this tea time 2 hours. No, 30 minutes not enough, right? If you want to sleep, you need to 1 hour more, right? So they give you 2 hours practice time. So wonderful. So if you can speak English very well and that you can pass their registration, get the nurse certification, maybe you can consider to there. Yeah, as a nurse. Yeah, and the pay very high. But you know, no one likes to be a nurse in American. Yeah, also in Taiwan. Do you want to go to American? Oh, really? Great. Yeah. And then the second is the observation, right? How to do it. You know, so far I suggest all of my students, please observe your environment and to see why the person, the worker, or why your faculty or why patient wants to that the behavior. Yeah, because I found the occupational health nurse, I observe they are so work hard. They need to stand there and look at 2 hours, maybe. Yeah, and give the score. And also need to the record the video. So two-person, they need to check their consistency and then sometimes not so very well. So I found this question. So I think, how do I do? Yeah, so maybe AI can help me. So I review so many of the literature related to that. Yeah, and find available uh, strategy, discuss about our informatic engineer informatic. Yeah, and they also think about this kind of the problem, how to solve. Yeah, understand?
Excuse me,
So,
Professor.
okay.
You can
Oh,
stand here.
sorry. Yeah,
It's okay.
because
You
I
can stand here
forecast
in the
her.
middle. You can stand here in the
Okay,
middle.
thank you. So
Okay.
I think that it's uh I suggest you need to observe your surrounding. Yeah, and the very detail. And if you have a question, write down. Yeah, and firstly, review the paper and what's the strategy can help us. Also, bring this question can discuss with your teacher and as your project. Now you need to do the research project, your student. Oh, good. My God, that's so high quality in here. Yeah, wonderful. Yeah. So that is my answer. Maybe I did not fit for your fit. Expect on the table you discuss with me. Okay. Thank you.
Is there any other questions? Okay.
Let me introduce myself. My name is Kaila Nasiausti. You can call me Kaila. I have one question for you. In using digital systems for ergonomic training, how do we ensure that the technology itself does not introduce a new form of ergonomic risk, such as eye strain or repetitive stress injury from excessive screen use?
Thank you.
Oh, thank you. Give her props, okay? Firstly, I also admire our student. So sweet, your name. And I really feel amazing why your English so great.
Thank you.
Yeah, can speak so well. Yeah, and ask the question so smart. Yeah, firstly, I need to admire you. Yeah, good student, right? Yeah, I don't know. I can completely catch for your question or not, but for my firstly, I share my study. We train them and teach them, give a class. Yeah, so if you a nurse in there and you can request your boss open health promotion class for you and do you and teach you how to do the exercise and protect yourself. The other one in the school label, I I suggest and expect our faculty can teach you implement the correct skill in under the correct posture. Yeah. Do you know how to do the correct posture for patient change position? Do you know? Yeah, it is related to the occupational health knowledge. So maybe some of the class need to cooperate with the others uh, professional field to discuss about teach the class about how to design. So now every day you need to train yourself. Do you know the core muscle? Some of the handsome men they have a muscle in here. Our boys, male student, do you have a muscle in here? Uh, maybe you don't understand what I say. Never mind. Never mind. My answer is for that, but maybe I did not match with your needs. So we also can under private to discuss about that. Okay. Yeah, your question is really good.
Thank you so much for the question, and thank you so much for Professor Chijing. But before we close our agenda, Sticker Pepen Ijo Barat will give you a certificate, and we will take the photograph with you as a document.
Okay.
To Miss Eva Supriyatin, PhD, you can come up to the stage and give the certificate to Professor Chijing.
Thank you. Thank you. Yeah, I love all of you because I found our student really smart. Are you? Are you smart?
Macam-macam kamu aja.
Thank you to everyone for your attention and question. I will now respectfully return the session to our Master of Ceremony. Wassalamualaikum warahmatullahi wabarakatuh.
Siya to ba? Macam mana itu? Ada sempat na to.
Thank you very much to Professor Wang Chichen for the insightful presentation, and thank you to our moderator, Anisia, for leading sessions following. Ladies and gentlemen, we will now proceed to lecture session 2 by Professor Tukimin Bin Sansuito, who will be sharing his expertise on become a smart nurse, practical technologies every nursing student should master. This session will be moderated by Nurul Ilmi. Before we begin, please allow me to read Nurul Ilmi curriculum vitae. Nurul Ilmi, she is a third-year nursing student at Stika PP Jawa Barat, who is currently developing knowledge and skills in the nursing field. She actively participates in student activities, community service, and various technology-based projects designed to support health education programs. Her achievement become the
Speakers, Prof. Kimin Bin Sansuito from Lincoln University College, Malaysia. Now, I'm going to let you know the curriculum vitae of Prof. Kimin Bin Sansuito.
Okay.
Okay, Prof. Kimin graduate at Lincoln University College, Malaysia as Doctor of Philosophy in Health Science at 2021 and worked in Lincoln University College, Malaysia since 2016 till now, and journal publication with titled Development of a Storytelling Module to Reduce Hospitalism Anxiety in Preschool Children, a Pediatric Nursing Intervention at 2025. Okay, today he will be presenting a topic titled Become a Smarter Nurses, Practical Technologies Every Nursing Student Should Master. In this season, Prof. Tukimin will guide us through essential technologies that support clinical decision-making, streamline nursing workflow, and prepare students for the demands of a healthcare system that is rapidly evolving in the digital era. Okay, now without any further ado, please joining me in welcoming Prof. Tukimin bin Sanswito. Please give your full attention and a big applause.
Okay, Assalamualaikum warahmatullahi wabarakatuh, and good morning to all of you. So, how are you today? Okay, so you look so smart today. Yeah. Okay. Please allow me to share my screen. Please unshare your screen, please.
Okay.
Yeah, they're expected to maybe the director, yeah, of the 60 KPPNE, and then academic and the student affairs, yeah, then master of ceremony, then yeah, the participant, yeah, in this symposium. Yeah.
Kata Bu Suci tadi udah gitu. Yang nggak
Okay,
boleh.
can I share my screen? Okay, I will start my topic. Mathematics actually become a smartness. Yeah? So when we hearing the words of the smart, yeah, in our daily life, yeah, we often found, yeah, the simple like in research, in the clinical practice, yeah, or maybe related to the smart technology. Yeah, but including our daily life also, we often use, yeah, the words of the smart, yeah, as to reflect, yeah, the like intelligence, maybe clever, or maybe, I mean, the excellent. Yeah. Okay. Whatever. Yeah, the smart. Yeah, actually become the current trend. Yeah, in the recent era. Yeah, because we recognize also. Yeah, with the term about the healthcare or the smart healthcare era. Yeah, actually after, yeah, the industry 5. Okay, but before we talk about the smart, actually, our target actually nursing student. Yeah, but talking about the smartnesses. Yeah, so we will look at from the student angle, how, yeah, the smartnesses, yeah, can be materialized, or can be realized. Yeah, we have to understand what is the nursing, based on the American Nurses Association. Yeah. Nursing actually, the professional discipline that deal, with the promotion of health, the prevention of the illness, and the holistic of care. This actually, yeah, not very, I mean, a superficial concept. Yeah, in depthly, like a prevention also can be divided into the simple like primary prevention, secondary prevention, include early detection and promptly treatment, include here, the curative here also, and the part of this one, to prevent, the disease become more severe, or maybe to prevent, from the disability and limitation. Actually, everything in these concepts. We agree also that nurses has to deliver the holistic care, and not only focus on the physical, but include the bio, psycho, social, and spiritual. Yeah. So who is our client? Yeah. So the smart nurses has to understand, has to knowledgeable that our client actually individual, families, and the community. So how we practice, as the smart nurses, we have to consider the evidence-based practice. Evidence-based practice, to understand this concept, actually on the words of the integration of the base research evidence, then clinical expertise and patient's value and preference to improve the practice. So nurses has to consider the three components, yeah, as part of the evidence practice, yeah, actually include the base research evidence, the clinical expertise, and patient value, and the preference, yeah, or you call it also as the culture competence, yeah. Okay, then as the professional discipline, nurses actually has very specific and typical the body of knowledge. The body of knowledge normally will develop by the research, and then from the body of knowledge we actually learn how to practice. So the professional practice in nursing should be based on the knowledge, and based on the skills, they normally get from the formal education like diploma or maybe degree in nursing schools. So from the body of the knowledge and the professional practice, we recognize the role of nurses, like the basic roles and then extended roles. Okay, maybe this presentation actually focus to stimulate later for your discussion. If anything, you can ask the question and we can discuss. Okay, published literature. So there are some the acronym the words of the nurses look like very nice. The nurses also every word has meaning. The symbol N stand for the nurturing. We have to show the compassion, because the nurse actually the caring professions. So we have to perform compassion, the kindness, actually, and not only just the responsibility to the patient, but we have to consider the human relationship. And then we have to consider the patient actually not an object, but the patient also a subject, with the physical and the emotional need. You actually understanding as nurses, we have to understand what patient feel, what patient complain. So we have to demonstrate the empathy. Then we have to understand the culture sensitivity. We have to improve our the cultural competence. To realize just now, the evidence-based practice. In improving the quality of care. So we have to become the good listener also, to understand the patients. R stand for the responsible, be accountable for our action, because everything should be accountable, reasonable. Why we have to do it? Why we have to do this? So include the decision. Actually, many decisions in the nursing profession are based on the research or based on the scientific values, as the cornerstone in the decision making. So we have to responsible for all the population or the patient to deliver the quality of care without any discrimination. Okay, next one, skills. Stand for skills. To maintain the clinical competence just now. The clinical expertise is a very important component. To improve the practice. Actually, the smartnesses has to skillful. In the clinical practice. Actually has to enhance with the ability to do the critical thinking and evidence practice. Just now we explain. Well, explain empathetic. This is only one component of the quality of care also. We have to feel. We have to talk and correlate. The relationship with the human level. Wait for a while. The red one. Okay. We have to understand the contemporary healthcare professions. Okay. Talking about nursing, we have to consider what we have to do. Actually, we agree that nurses has to deliver the holistic care, then empowerment, and the autonomy, then partnership and the collaborations, then personalized care. Now, this may be the ability, or the very important component in the nursing care, to realize the patient-centered care, as the new trend or the recent trend or approach, in the delivery of the nursing practice. Uh, Actually, published research of the literature found or indicate that the patient-centered care actually was associated with the health outcome, or better health outcome, then patient satisfaction, and the health care costs, and then the quality of care and job satisfaction. So while this one. Mm. Okay, patient-centered care. Yeah. This become a center of our service. Yeah, that everyone has to focus to the patients. Yeah, as the subject of care, object and subject. Actually, patient-centered care mean one patient actually take care by the multidisciplinary teams. Yeah, so the smart nurses has to collaborate. Yeah, we have to build the interprofessional collaboration. Then start with the interprofessional communications. Yeah, talking about the interprofessional collaboration and the interprofessional communication, this should be start from the beginning. Yeah, during education, it's very important as nurses from the beginning to understand their on the responsibility and the professional boundaries for each discipline. Yeah, what boundaries for the doctor, midwife, dietitian, physiotherapist, and others. So, very important from this, strategies that we have to recognize our own independent care and the collaborative care. Yeah, because this some in some country become a major issues because we don't know or the barrier or maybe we don't know the boundaries of the professional authority. Okay. Talking about the smartnesses, actually, I bring the Malaysian values. In Malaysia, actually famous in about the 10 S. But I bring and introduce to you the 5 S. Why 5 S? This actually related to the direct performance of the nurses in the clinical practice. Without this one, patient will maybe complain or doesn't satisfy. Yeah, this actually is the character, the typical character of caring, that we have to carry forward in our clinical practice. The first S actually senyum, a smile. Yeah, actually, in every time we communicate with the patient, we have to start with a greeting and click warmly. Yeah, showing friendliness and approachability. Then salam, greeting. Yeah, so don't forget, as necessary, we have to consider all of this. This is usually considered as the like the soft skill, because talking about the clinical skills, we have to consider the soft and the hard skill, So soft skills sometimes, greatly associated with the patient satisfaction and good human relationship. Yeah, we have to greet the patient, with the Assalamualaikum or maybe with the local greeting. Then we have to sapa. Yeah, actually we have to call a patient with their name. So it is very important to appreciate. A call by the name, then make eye contact, then show interest. Then segak their sample and neat, presentable. Then maintain professional appearance and hygiene. Dan santun, the example pada service the polite, the politeness, courtesis service, like when we speak, polite, this is actually listening attentively, and then provide respectful and empathic care. This is considered as the soft skill that we have to develop, to realize the smartnesses. Yeah. Okay, smartness is actually, when we talk about smart, actually, in nursing, as I said, with the smart framework, that we have to apply the symbol in the clinical decision making, then the patient care plan and for the professional development. I mean, we have to set our goal, in the clinical practice, and the professional development, by the smart framework. maybe just very superficial, yeah, in our understanding about the smart framework, yeah. Actually, everyone knows, yeah, that when you develop, yeah, the documentation, or maybe you maybe write the nursing care plan, there's you will use this one, yeah. But actually, in advance, yeah, not only about the documentation, not only just about nursing care plans, yeah, but we can develop widely to set the goal, for example, as the nursing student, yeah, to set the goal of your study. Yeah, you have to clearly specify, yeah, your goal. The example, your goal should be measurable. The example, your goal make sure can be realized and achievable, and then your goal should be relevant, yeah, with the professional background and time bound. The example, your study for degree, the example, will be finished in 4 years, yeah, or 5 years. The example, yeah. So you have to set up, yeah, your objective, yeah, based on the SMART, the framework. Okay, the literature published some also shown, yeah, that smartnesses has look like the acronym that we can take as a point, yeah, point associated with the professional practice. The simple and the S stand for the safe practice. Patient safety. The patient safety actually become priority, yeah, in the nursing practice. Yeah, but you have to remember that patient safety, we have to start from the patient safety. Yeah, therefore the nurses should be skillful later. Yeah, nurses has to very good performance, yeah, in clinical expertise. Yeah, to realize the patient safety. Then we have to follow the Ministry of Minister of Health guideline and infection control protocol. Yeah, specifically, like in Malaysia, the example, yeah, everything we have to follow, yeah, the guideline from the nursing board, yeah, include the ethical, yeah, consideration. Yeah, we have to practice, yeah, based on the ethic, and we have to avoid, yeah, from the malpractice. M stand for the multi-skill and the multicultural. Yeah. Multi-skill mean we have to competent, yeah, to do the various nursing skills. This is actually part of the clinical expertise ataupun kepakaran klinik, ya, in bahasa, ya, that we have to develop, ya, together with others quality component, ya, like research, ya, and the culture based actually care, yeah. Recent era actually become a trend, yeah, about the cultural competence. We have to understand, yeah, the background, culture of the patients. Yeah. The respect multicultural and the multi-religious diversity. So we have to consider the patient value and belief, yeah, and various difference, yeah, related to the different ethnicity. Then provide the culturally sensitive, yeah, for the nursing interventions. Okay, then A, yes, stand for accountable and adaptive. Yeah, and this has to responsible, yeah, for the actions and the professional growth. Actually, not only just to do the routine activities, but we have to consider, yeah, for the professional growth, yeah, we have to update our knowledge and skills, yeah, through the professional development. So we have to adapt. The simple adapt, yeah, the new technology, because there's no, I mentioned that smart sometimes also associated with the smart technologies. As we have to learn, yeah, to improve knowledge and skills, yeah, how to use, yeah, and choose, yeah, the proper technology for the nursing practice. Yeah. Then uphold the integrity and the professionalism, yeah, at all time. Actually, our behavior in practice, yeah, so we have to follow, yeah, the value of the professionalism. R actually stand for research oriented and resilience. Yeah, research become a cornerstone, yeah, for the body of knowledge development. Yeah, and for the cornerstone, yeah, for decision making. Yeah, previously I explained to you that research, the best research evidence, actually one of the important component, yeah, to materialize the evidence based practice. And not only just to translate, yeah, research into practice, yeah, but we have to realize and merge, and we have to integrate, yeah, with the clinical expertise and patient value and preference. Then participate in the nursing research and innovation. Basically, research actually one of the extended role for the nurses then we have to contribute to uh, identify the new strategy, the example or to find out the best practice or maybe the best strategy to practice specifically related to the technologies and stay resilient during crisis. This stands for the teamwork and the technology driven. So we have to collaborate with the healthcare teams to deliver holistic care. The collaboration recently also used the technology. Not only just a direct face-to-face meeting. Actually collaborate in the system and then collaborate. Maybe use the digital tool and others. We can actually use the existing technologies to improve the practice like telemedicine, electronic health record, the example. They promote continuous learning in the nursing, technology, actually related to healthcare practice. Okay, smartphone nursing a student, because we have to look from the student angle, as for the student, we have to take responsibility to do the proper action to achieve the study goal or study objective to get the best teaching learning outcome. Then we have to learn and practice by the patient safety. Then we adaptive to the healthcare change, technology, and the global nursing standard, specifically technology, include the smart technology. We have to learn knowledgeable and adapt the new technology. Then we have to follow the nursing code ethic, basically. Then R stand for the respectful and research oriented. Actually respect the patient culture, religion, belief in all interaction. Actually, we cannot spread the patient from their socio-demographic factors, but we can consider and appreciate to improve the outcome of care by considering their patient value, belief, and social culture. Best your nursing practice on the research and evidence. This is really how to improve the practice. Evidence of research is very important. Previously I talked about the evidence-based practice. To improve the clinical outcome. They promote dignity and equality of care, specifically for the vulnerable population. We have to provide the quality of care equally, without discrimination, because of some socio-demographic or different socio-demographic characteristic of the patients. Then T, actually teamwork and the technological literacy, specifically about the student, because now actually knowledge, I can tell you the knowledge is free if you want. Actually, you can search everything exists in the internet. So the technology can be used to search the literature, the literacy. And just know the previous speaker mentioned about the ChatGPT, the simple the ChatGPT. This is really able to search to search the material or maybe to get the proper knowledge, might be able to learn, but we have to understand also that the AI, is some outcome, actually we have to consider, the advance should be the human should be advanced to use the AI, and actually we worry the outcome of our study look like excellence, but we still remain stupid. That simple. That is one gaps, a possible gap, when we learn use or maybe very depend to the AI and the example. Then collaborate with the classmates, clinical instructor, and the healthcare team. Then use digital tool and nursing technology, like just know the electronic health record, and mental health. Then we have to prepare for the smart healthcare era. Yeah, this is really recent era. Yeah, in the healthcare, they actually enhanced by the technology. There are some paradigm shifts here in the smart healthcare era, yeah, from the previous era. Yeah, recently, actually the healthcare actually concentrate, yeah, focus on this one, the human centric innovations, yeah, related to the technologies, specifically collaboration, yeah, between AI and human, yeah, AI and human, yeah, and the technology, like the robotic, the example. I mean, we have to learn and we have to try to collaborate, yeah, because we expect, yeah, the AI and the technology doesn't replace the human, yeah, but we can collaborate, yeah. We have to control it, the AI. It's really like a robotic technology. It is really not new, actually, yeah. But the AI maybe this still become the great phenomena, yeah, to improve the practice. There are a few students, yeah, for, I mean, the PhD, yeah, PhD student, yeah, actually develop the AI, use the AI to improve, yeah, the clinical decision making, the simple, to improve the patient safety, yeah, and others. This actually still become great challenge. Yeah. However, yeah, there are some advantages and disadvantages also that we have to cope. We have to control. Yeah, we have to minimize, yeah, the disadvantages, because of the AI. Yeah, the simple, regarding the assignment by the student. Yeah, actually, we worry the assignment is very good, but the product, of the AI, meanwhile, the student don't know anything, about the assignment. Yeah, actually, in Lincoln, actually, recently, we concerned about this issue. Then we try to implement, the new kind of the curriculum, value-based curriculum. Yeah, value-based curriculum. And value-based curriculum, we have to support the possible stupidity because of the AI. Actually, every student in each semester has to publish one article related to the topic. This actually consider, yeah, the issue to cope, yeah, this era. Then proactive for healthcare, moving beyond reactive automation toward predictive, preventive interaction that anticipate patient need before they escalate. Actually, by using the AI, then the current technology, then the predictive and the preventive strategies actually become, I mean, more advanced, more advanced. For example, like, yeah, some chronic disease, yeah, actually can be predict. Yeah, can be predict. There are some the simple like machine learning. The simple, yeah, it also can be used, to predict possible the complication of the post operative, yeah, etc. The intelligent collaboration, healthcare professional work, yeah, alongside intelligent machine, yeah, like augmenting clinical decision making while maintaining, yeah, the essential the human touch. Okay, this simple about the intelligent variables, yeah, the previous speaker also mentioned all about this. Yeah, this actually greatly influence, yeah, the healthcare. Yeah, but maybe in the implementation, yeah, still under, I mean, manufacture, or maybe under, I mean, the development. Yeah, but we recognize well, yeah, the wearables, I mean, technologies, yeah, like smartwatch, they're simple, yeah, they're containing like the ECG, the blood oxygen monitoring, then blood tracking, blood glucose, might be, yeah, to track, yeah, the need of the energy, they're simple, yeah. Then technology like a biosensor, they're simple to tracking the blood glucose, hydration, and vital sign, air power, air fitness, air tracker, yeah, with the predictive health analytic, they're simple. Yeah, but we have to understand that there is some advantages and disadvantages also. Yeah, we recognize the simple, for the digital product. They want each other actually. Yeah, there is issue, about the reliability. Yeah, the reliability of the result or the outcome. Yeah, then we have to cross check with the standardized. Yeah. We remember in our daily practice, before, I mean, AI become family among us. Actually, we use the digital, the simple PP, digital PP. Actually, some digital PP, different products sometimes, yeah, actually got a different outcome of the measurement. Yeah, therefore, in some cases, yeah, is there is issue with the result. Not reliable the sample. Normally, we will go back to the manual one as the standard. The sample like manual manometer the sample. However, yeah, advanced technology we have to control, and then we have to support, yeah, with the standard, yeah, we ask the human life. Why? Because AI, the robotic, it is very excellent, yeah, but without brain. So we have to worry about this. Actually, human has to control, yeah, the AI and the technology. Then machine learning impact the sample, like random forest models, yeah, analysis here to predict patient activity pattern, yeah, with a remarkable accuracy. Actually, one student from Purwokerto, yeah, actually study about this, yeah, about the random forest model, yeah, to predict, yeah, actually future condition of the patients. And then about the Internet of Things, it's actually not new, yeah, recently, yeah, but still become a trend, yeah, because the applicability, yeah, like real-time data collection, it is possible, with the Internet of Things. Yeah, it's simple for the research, yeah. Actually, we can collect the data in the same time, yeah, for the cross-sectional study, it's simple, yeah, only by using a particular facilities, yeah, in one point time for the large data, it's simple, yeah. The secure wireless transmissions like the Bluetooth, the assemble ZigBee, secure Wi-Fi, the assemble actually will facilitate and improve, and the accessibility of the information and data. Then early detection and intervention, actually many study, many research, yeah, start to develop the simple, the tool for screening digitally, then tool for the prevention digitally, etc. Include and the virtual intervention the simple. Actually, there are new trends about physical virtual integration, yeah, during this era. Yeah, actually include in the teaching learning in nursing educations. Maybe speaker after me, yeah, will explain all about this, yeah, related to the physical, the virtual technologies, yeah, in nursing education. The telemedicine integration, yeah, this is really commonly used also. Yeah, it will be useful, yeah, specifically to improve, yeah, the accessibility of information and care, yeah, specifically for population, yeah, under remote region. Okay, now we're talking about become a smart nursing student. Actually, we have to start, yeah, from the beginning, yeah, to become smart, yeah, during education. Okay, we have to strengthen the critical thinking skills. The simple, our behavior, our skills, our learning and our action in the hospital, they are simple. We have to provide the reasoning why we do this. Why in this process we have to do this. Should be reasonable. Yeah. Then we have to reasonable and also symptom. Why? Patient with the DM got the simple neuropathy. The simple why patient with DM got retinopathy, etc. Yeah, or include the intervention. Why patient with the chronic disease like type 2 diabetes mellitus actually high demand to the lifestyle intervention very simple. Actually, we have to provide the reason. Become reasonable. Yes, smartness students should be reasonable and knowledgeable. Use clinical reasoning framework, yeah, actually to to do something we have to provide the reason. Yeah. Some also it's very important, yeah, in the case study the example, yeah, because in nature some student will provide, yeah, will submit the case study. So in the case study you have to provide this one, yeah, the clinical reasoning. Yeah, include in some actually interventional research or clinical research. Yeah, so we have to provide, yeah, the good clinical reason why we have to do this study, why have to take this case, the example. Yeah. Then provide analyzing the study and not just memorizing fact. Yeah, actually scenario, the case study will allow students to identify and analyze, yeah, and to evaluate, yeah, the case. Yeah, this actually will increase the ability of the critical thinking. The example, yeah, why patient, yeah, after the simple steroid medication, yeah, by the nebulizer has to take one water gargle, the example. Yeah, the example. This really will provide, yeah, a reason. Yeah, this is really very good, yeah, for the case study to improve the critical thinking skills. Always verify information with the evidence-based guideline. And previously, we have to consider the research, and then we have to improve our clinical expertise. So don't forget, we have to consider the patient value, yeah, and other backgrounds. Okay, master of the foundational, intelligent nursing, they have to strong base on this one. But it's actually the basic. Yeah, basic that we will actually, effect, to the more advanced topic and skills. Yeah, like anatomy and physiology. Actually, every subject, yeah, specifically about the health subject, yeah, actually will relate it to anatomy and physiology, yeah, include the pathophysiology, disease, the simple. Actually, when we actually capable and understood, yeah, about anatomy and physiology, very easy to learn pathophysiology and about the disease, include the symptoms, the simple. Then pharmacology and medication safety, yeah, pathophysiology as known, then microbiology as the agent, yeah, of the communicable disease normally, yeah, like virus, bacteria, yeah, fungus, etc. Then nursing ethic and law. Yeah, so we have to understand all of this. So study smart, not hard. This time, meditate. Yeah. Actually, we have to active recall instead of passive reading, yeah, just to more understand the summary topic, example in your own words, did someone else. Actually, when we reflect, when we discuss with others, yeah, so automatically we have some knowledge about this. So this, however, the study is art, yeah, very depend on the personal. Yeah, so we cannot fix the study hours should be this, should be like that. Cannot. Yeah, we consider. Yeah, you can initiate, yeah, based on the best technique, yeah, for your study. Then apply knowledge in the clinical setting. Yeah, so relate classroom theory, yeah, to the real patient situation. We have to bring, the theory into practice. We have to bridge, yeah, the theory practical gap. Yeah. Actually, the person in charge normally, yeah, to directly the bridging the gap, actually clinical instructor. You will be guided by the clinical instructor, but the student has to prepare, yeah, how, yeah, to provide the theory and to bring in the clinical practice. Yeah, it's simple. Like in Indonesia, normally we use, yeah, we call it as the pre-report, containing, yeah, how we perform, how we assess, how we interpret, what the nursing diagnosis, based on the theory. Then you bring to the clinical practice, then you meet, yeah, the real patient. Ask the preceptor questions. Preceptor actually look at the instructor, yeah, in the hospital, and they know well, about the case. So we have to learn, yeah, from the preceptor. Then reflect after it's safe. Yeah, what did I learn? And what can I improve? Actually, reflection actually one of the teaching, actually learning strategies also. The reflection, yeah, reflection. That's but before you go to the patient, so you have to prepare your knowledge. Yeah, what I have to do, and what questions should be asked to the patient. They're simple. What data should be collected. They're simple. Step by step of our nursing procedure. They're simple. Yeah? So you can reflect before you meet the patient. So this will improve, yeah, your competence, yeah, in real practice. Practice clinical skills, regularly in the skills lab. We know that nursing is the applied science. Yeah? We learn the theory. We learn to get the knowledge and to practice. Yeah? Before go to the clinical practice, normally we have to demonstrate in the skills lab. And develop the EPP mindset. Remember, yeah, to improve practice. Yeah, don't forget about the EPP. Yeah, the best research evidence. Yeah, you improve the clinical expertise. Then, so we have to the culturally competence. We have to consider the patient value and preference. If necessary, yeah, periodically, the sample every 6 months. Yeah, so you can conduct a survey the sample for the patient satisfaction. The sample to understand the patient response. Yeah, so we have to read the article to update the knowledge. So we have to update our skill and practice, according to the current evidence. Then know how we have to evaluate evidence. Then use the latest guideline, the sample such as from the WHO, like the hand wash, the sample from WHO, and standardized by the Minister of Health, the sample. Yeah. Then CDC also they publish some the guideline there for some chronic disease. Then understand statistic and the data interpretation. Actually, basic understanding about the data analysis should be included to become smartnesses, because smartnesses has to able to do the simple survey for the problem from the problem solving and decision decision making. Okay, improve problem solving abilities. Yeah, use nursing process. This is really our basic. Yeah, I mean activities. Yeah, in nursing care. Actually, by the nursing process. Yeah, assessment, how to assess. Yeah, we have to consider this diagnosis, how to write the diagnosis based on the NANDA, the sample. Yeah, NANDA standardized. Then how to write the planning, the implementation, and evaluation. We have to follow the standard, all of this, because I believe that in each country in in each hospital has their own standardized guideline for to do the nursing process. Think ahead about the potential of the complications, specifically for the chronic disease. Chronic disease actually characterized by the complication. So we have to prevent the simple by the complications. Then prioritize patient using ABC, airway breathing circulation, then Maslow, the simple Maslow human need, and thrice principle. I mean, in many cases, because we found so many problem in one patient, so
Excuse me, Prof.
we have to
The
prioritize.
time, Prof.
Yeah.
The time is 5 minutes for presentation.
Okay. Okay. Then, uh, okay, use S bar for handover. Maybe I'll focus to the S bar. Yeah. So we have to manage time. Yeah, and stress wisely. Yeah, actually during our study, include during clinical practice. So we have to manage also to avoid from the burnout. Yeah, and uh, with effective problem solving. Yeah. So we have to learn interdisciplinary collaboration just now. I just briefly explained. Yeah, interdisciplinary communication is very important. Yeah, from the beginning, we have to start. Yeah, during education. Yeah, to recognize the professional boundaries. Yeah, for each disciplines. Yeah, and recognize how to communicate with doctor, pharmacist, physiotherapist, nutritionist, social workers, and others. Yeah, should be start from the beginning. Yeah. Use technology to your advance, yeah. This usually become focus associated with the smart technology just now. Yeah, AI commonly actually recognized by the student can be used. Yeah. Okay. It's very important to introduce the S bar format for the hand software. Yeah, because in many cases, actually student don't have a particular format to do the handovers. Yeah, so smart nurses has to plan what should be offered during the handover. Yeah. S stand for situation. Yeah, situation. State what is happening right now and why you are calling or handing over. Actually, normally we have to include our name, our role, then the patient name who under our responsibility, the age, what's the sample and the bed number. Other than current issue, current issue related to the health problem is suffered by the patient and or reason for the handover. I give you an example. You can use this one, the example. Good morning, I'm Nurse Aisha from What's 5B, the example. Yeah, I'm handing over to Mr. Lim, 68 years old, admitted for pneumonia. He is currently experiencing, yeah, increasing the SOB, the example. This is only the situation. Situation mean patient, the example, suffer from SOB because of the pneumonia. Focus on background. Provide relevant clinical history and essential information to include diagnosis, allergies, the past medical history, then baseline observation, and the medication treatment, and etc. The example, he was admitted 3 days ago with a community-acquired pneumonia. He has a history of the COPD and hypertension before. He is on IV, ceftriaxone and the nebulization. No known drug allergies. His baseline SpO2 is 92%, on 2 liter nasal from oxygen. That's the background. After you explain the situation, you have to explain the background of the patients. Organizational assessment. Say your clinical findings, and concerns. Include the vital signs, physical assessment result, then current changes, from baseline in nursing judgment. For example, currently his respiratory rate is 28 per minute, then his PO2 drop to 88% on 3 liter oxygen. And he has audible wheezes. Audible means we can hearing without stethoscope the wheezing. Then temperature is 38.5 degrees Celsius. The lung auscultation show crackles on the left lower lobe. His condition is worsening from this morning's assessment. The next one, R. S bar, let's lead to R. R is stand for the recommendation. State what you think is needed next. Include what action is required for the next one. Then urgency, what urgent intervention should be done. Then further review or orders requested. For example, I recommend a medical review as soon as possible. He might need the escalation to high flow oxygen or adjustment of the antibiotic. Then kindly assess for possible respiratory distress. Okay, this is actually example of the SBAR handover summary. This one, actually handover by using the SBAR. This is Nurse Aisa from Ward 5B and handing over care for Mr. Lim, a 68 years old male admitted with pneumonia. He is currently more breathless and desaturating. For B, admitted 3 days ago for the community-acquired pneumonia. The past history includes COPD and hypertension, on IV antibiotic, nebulizers, and oxygen therapy. No allergies. The baseline SpO2 is 92% on 2 liters of oxygen. A, now decelerating to 88% of the SpO2 with the 3 liter of the oxygen, respiratory rate at 28 per minute, temperature 38.5 degrees Celsius. Then crackles noted on the auscultation, signs of the worsening respiratory distress. R, to request immediate medical review. Then please consider escalation of the oxygen therapy, repeat chest X-ray, and possible antibiotic revisions. The conclusion, become a smart missing student that requires strategy. They include the critical thinking and the consistent self-improvement. And this is my framework in many kind to realize specifically the goal of the study and practice. And success also depend on the evidence-based practice, yeah, to improve the clinical practice, effective communication, the technology use, and strong professional values. By staying disciplined, reflective, and proactive, a nursing student can build the competence and the confidence needed, yeah, to deliver safe and high quality of the patient care. Okay, thank you. That's all from my side. Yeah? Okay, thank you for your attention and the time I give to the MC.
Okay, thank you very much, Professor Tukimin, for the insightful and empowering presentation. We will now open the Q&A season. If you have a question, please raise your hand or submit it through the chat. Okay.
Uh, Let me introduce myself first. My name is Hafiz Indara Putra Rustiana. I wanna ask one question here. The presentation defined a smart nurse as being multi-skilled and multicultural and technology driven. The question, how can a nursing student effectively integrate advanced technology literacy? For example, using EMR, telehealth, with the essential soft skill of cultural sensitivity and empathy to deliver truly holistic and patient-centered care in the Industry 5.0 era. Thank you.
Okay, a very good question. Yeah, I actually talking about the nursing cadre. So how the nursing cadre can integrate? Yeah, actually just now about the multi skills. Yeah, and the culture and include the technology. Okay, when we talk about the integration, yeah, this is really a strategy, right? A strategy. Okay, the strategy should be based on the science, yeah, or based on the concept, basically based on the knowledge. Yeah, the firstly we have to improve the knowledge of the cadre. Yeah, we have to improve, yeah, the knowledge of the cadre, yeah, about the required skills. What skill, yeah, we want to integrate, or what skill, yeah, we want to improve. Yeah, simple. Yeah, so basically, the cadre actually a person or people, yeah, who direct contact, yeah, with the population in the community. Yeah, so the question is very good. Yeah, we have to consider, yeah, the background of the population. Yeah, because they come from the multi ethnicity and with the different background, yeah, social, culture, value, and belief. Okay, firstly, we have to consider the philosophy of the nursing practice that we can, yeah, differentiate our patient, our clients, based on their socio-demographic characteristic. The differentiate can, but for the better service. The example from Sudanese, the example. So we know that the Sudanese has the particular advantages, yeah, for the human need, the example. This can, yeah. But to integrate, just now, so automatically we have to improve, yeah, the skill, yeah, the simple, by using, yeah, the maybe training or maybe workshop, yeah, firstly, yeah, to improve, yeah, the clinical expertise or maybe ability to perform, yeah, their tasks, yeah, associated with the intervention in the community. Okay, okay. Next one. So we have to facilitate. We have to facilitate the cadre, yeah, to engage, yeah, the populations. Yeah, because the strong, in the public health care actually, yeah, actually, yeah, from the population. Yeah, actually the principle actually from the population, yeah, by the population and for population. That's the basic principle in the community, in the community healthcare. And therefore, we have to facilitate the cadre to engage the population. The simple, we can provide some form, the simple for survey or maybe for communications, and others. So after that, we have to identify what the technology required for the cadre. I mean, for the treatment, for the intervention, the example. I give you an example. The example, the cadre need the technology like for the blood glucose control and the example. So we have to teach how to get and how to choose how to use the example. Actually, the cadre normally also will educate. Cadre normally will educate the population. So we have to teach cadres also how to teach the cadre to the populations. Okay, actually the integration should be there. Yeah, the integration should be there. Yeah, not only the thing that we have to perform like just know about the technology, about the culture, then about the task, the example. Not only that, but we have to integrate, with the I mean, the multi-sectorial, because we never work alone. Normally, we work as a team, the multidisciplinary team. The multidisciplinary team. Actually, when we prepare the cadre, actually we have to uh, include the multidisciplinary team, to assist, I mean, the integration between the improvement of the skills, then the community engagement, or the patient value and preference, and the clinical skills. Is it okay? Is it answer the question?
Okay, thank you, Professor. Any question? Okay.
Okay, let me introduce myself. I am Nata. I would like to ask regarding the following point. The definition of nursing include holistic care.
Yes, what is your question?
Okay, ulangi, repeat. Let me introduce myself. I am Nata. I would like to ask regarding the following point. The definition of nursing includes holistic care, and the smart nurse model emphasizes teamwork. Explain how the nurse, as the central coordinator in patient-centered care, ensures true holistic care by integrating input from diverse professionals in the presentation: doctor, pharmacist, physiotherapy, and dietitian.
Okay, yeah, very good question. Because we never work alone, and then the contemporary and the nursing delivery model should be at the patient-centered care, with a very clear outcome related to the patient satisfaction and the quality of care. Yeah. Okay. Actually, the question is what the role of nurses and how their role nurses handle handle these issues. Yeah. Okay. Actually, scientifically, professionally, nurses are responsible to take care patient in 24 hours. This is the basic understanding and the basic rule. Yeah. Others professional, yeah, contact with the patients, basically, because the nurses invite them, this the profession is like this. Yeah, even though some profession like medical doctor look like dominant, but professionally, the patient and under 24 hours actually under control of the nurses, responsible in 24 hours. And therefore, the patient has to understand well, about their patient, about the cases. what the symptom, what the needs of the patients, yeah. So what treatment require the sample. Sorry. In this context, nurses has to understand just now about the dependent care and collaborative care. Yeah, collaborative care and independent care. I mean, collaborative care. Independent care actually what nurses can do without depend to others professions, can do it independently. Therefore, previously we have to identify, we have to recognize our own professional boundaries. Yeah, because without understanding about the professional boundaries, we confuse which one belong to medical profession, which one belong to dietitian, and which one belong to physiotherapist. Because this is actually also has superficial capabilities to do all of the the skills, for example, for the diet, for example, for the some simple physiotherapies, like range of motion exercise, range of motion exercise, that's so capable, and therefore we have to just know, we have to identify the professional boundaries, so beyond the professional boundaries, they actually belong to other profession that we have to invite, we have to collaborate, for example, with the medical doctor. The simple, if a patient need for a diagnosis, that simple, patient need the medication, that simple. Therefore, the nurse should be knowledgeable. Yeah, because nurse, so scientifically, the nurse actually not subordinate, and not subordinate, but actually same level of the professions. Therefore, nurses has to capable to for collaboration. Similar when patient suffer from IV by the simple, so we have to collaborate yet with the medical doctor to get the simple antibiotic. Yeah, antibiotic the simple. Yeah, so when the simple because of the infectious disease, then we facilitate for the lab test the simple found some maybe microorganism. Yeah, so we collaborate with medical doctor to give antibiotic. They're simple. Therefore, the nurses should be knowledgeable. Yeah. Okay, the role actually, and the nurses should be as the like, and the leader in this context, or maybe call it as the team leader. Yeah, team leader. Why a team leader? Because 25, 24 hours actually patient under responsibility of nurses, and then we have to collaborate medical doctor with the dietitian for the diet required by the patients, with the pharmacist for to get the proper medications. Midwife, they're simple because of the ONG problem, they're simple. Yeah, actually we manage. Yeah, we manage. Therefore, when you asking about the role, so the role should be as the case manager. Yeah, the role as the case manager. Yeah. Actually, this case will clearly, you can observe clearly, specifically in the critical care unit or maybe in the emergency department. Yeah, actually, what I observe, like in, the public hospital in Kuala Lumpur, that previously I routinely actually active, to guide the student over there. Actually, in the emergency department, once patient admit into the emergency department with the critical conditions, actually, the person who first take care the patient actually nurses. So the nurses will call the require, based on the need. The simple based on the primary survey, and then the assessment, and nurses found there is maybe fracture, then muscular damage, the simple, the difficulty in breathing, the pulse also unstable. So nurses will call related expert ataupun dokter pakar, kita panggil dokter pakar. Actually, in the emergency department, there's sometimes one patient actually treated by a group or a team of the healthcare team, multidisciplinary team. In the same time, actually, like the doctor who are expert in musculoskeletal, doctor who are expert in the cardiovascular system, a doctor who are expert in the endocrine, the simple, or doctor who are expert in eyes, the simple, actually come in the same time, in the critical situation. Who manage nurses? This is the role of the nurses. Actually, very dominant. Yeah, conceptually, professionally, actually, nurses actually superior and the dominant professional. So they're able to manage the case, not just only a follower and not only just look like the subordinate. Yeah, in the managerial level. Okay, thank you.
Okay, thank you very much, Professor Kimin. As our time has concluded, mastering practical technologies help nursing students become smarter, more efficient, and better prepared for real-world clinical challenge. By integrating those tools into daily learning and practical, future nurse can deliver faster, more informed, and high quality for patient care. We would like to express our sincere appreciation to Professor Tukimin for his valuable knowledge and inspiration. Please big applause. Before we close agenda, Stika PPNI Jawa Barat will give you a certificate and we will take a group photo with you as a documentation. Okay, thank you, Professor, and thank you to all participants for your attention and question. Ladies and gentlemen, I will now respectfully return to session to our Master of Ceremony. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh.
Thank you to our moderator Nurul Ilmi for leading the discussion effectively. Ladies and gentlemen, we now continue with lecture session 3, delivered by Professor Patsy Yates, who will be sharing her expertise on AI is not replacing you, how nursing students can use technology to care better. This session will once again be moderated by Anindya. For my beloved friend Anindya, the floor is yours.
Thank you very much to our Master of Ceremony for giving me the opportunity once again. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, allow me to reintroduce myself. My name is Anindya Deanira Putri and I will continue to serve as the moderator for our third session for today. Before we start the session, allow me to read the curriculum vitae of Professor Patsy Yates. Professor Patsy Yates, Master of Art, Philosophy of Doctor, Registered Nurse, Fellow of the American College of Nutrition, Fellow of the American Academy of Nursing, currently serves as the Executive Dean of the Faculty of Health at the Queensland University of Technology, Australia. Professor Yates has been the recipient of several prestigious distinctions, including the Academic Honor and Prestigious Award or prizes in 2020, as well as the Academic Honor of Prestigious Award or prizes in 2018. Her research portfolio is extensive, with a strong focus on workforce capacity building in cancer care, palliative care, and aged care, developing innovative approaches for managing cancer-related symptoms and treatment side effects, advancing health workforce development, and healthcare transformation. Professor Yates also contributed significantly to scientific literature through numerous publications, including components of home-based palliative and supportive care for adults with heart failure, a scoping review at 2025, feasibility and acceptability of a brief patient-reported experience measure within the hospital setting for individuals with palliative care needs and their families at 2025, co-designing the palliative care hospital, experience with clinicians, patients, and families drawn from a 2025 co-design workshop. Without any further ado, let's start our third session of a video presentation with the theme AI isn't replacing you, how nursing students can use technology to care better.
Generally to present to you today at all Symposium. My name is Betsy Yates. I'm very sorry I can't be there with you in person, but I was invited to the presentation to your meeting. I was delighted to do so. I send greetings from Brisbane, Australia, and thank you to the colleagues in Indonesia for kindly offering me this opportunity to talk to you about this really important and timely question. AI isn't replacing you. How nursing students can use technology to care better. It's just such a timely conversation. Let's start. We're going to actually talk about this whole topic about AI and nursing. We need to actually start by really asking this question about, well, what do we mean by nursing? You know, is AI going to actually contribute to nursing, or is it actually going to impede what our essence of nursing is about? And I want to start by actually, because it's, again, very timely, there's been this interesting conversation in our profession by the ICN about what nursing actually is about today. And we really have this opportunity to through this project that ICN has led, to reconsider what nursing is about. And I'll just make extracts here, which I just start this presentation, just reminding us about what the essence of nursing is. But eventually that answers this question about how do we use AI to help nurses deliver what nursing is about. So this new definition talks about nursing as a profession dedicated to upholding everyone's right to enjoy the highest attainable standard of health through a shared commitment to collaborative, culturally safe, people-centred care and services. So just take those points from there: collaborative, culturally safe, people-centred care. Nursing acts and advocates people's equitable access to health and healthcare and safe, sustainable environment. So again, think about what that means. Practice of nursing embodies the philosophy and values of the profession, providing professional care in the most personal, health-related aspects of people's lives. And really important, personal aspects of people's lives. Nursing promotes health, protects safety and continuity in care, and manages and leads healthcare organisations and systems. Complex work. Nursing practice is underpinned by a unique combination of science-based disciplinary knowledge, technical capability, ethical standards, and therapeutic relationships. And refers to us to ethical standards, therapeutic relationships. And nursing is committed to compassion, social justice, and a better future for humanity. So it's a very good question that we've been asked to talk about today. How do we actually use AI to help nurses care and deliver on this really important mandate that we have as a profession? On the face of it, it seems quite challenging. How can AI help us to actually be compassionate and have a better future for humanity? How can AI help us to address and support people in the most personal aspects of their lives? So this is what I'm going to talk to you about today. I'm going to start by just actually giving a bit of a broad introduction. Isn't that actually that new, really? In some ways, we've been using AI and digital health tools for many years. It's just that some of the more contemporary and ways in which AI is advanced has changed. So digital health, of course, we know digital health has really taken over our world in the last few decades. It encompasses a wide range of technologies, including electronic health records, telehealth, virtual care, wearable devices, and mobile health apps. And we know lots and lots and lots of evidence that other benefits. It gives us better access, better patient data, improved communication, enables us to monitor patients' health status, better decision making, better accuracy of diagnoses and treatment plans, more coordinated care, reduces the risk of clinical errors and timely and appropriate interventions can be delivered. AI-driven tools and apps constantly being developed to assist in these different aspects of what digital health can provide us, in particular in aspects of patient care and administrative tasks. And that's what we need to talk about today. What is it that how we can help nurses do that patient care part? And our tools been around for us for some time, supporting daily tasks of nurses in terms of detecting patterns, predicting patient outcomes, and enhancing the quality of care. They just haven't been sort of understood and as robust as some of the generative AI tools provide us today. So here's a little map from a recent article in Nursing Out, which really talks about, provides us this little sort of acronym about, and it uses the nurses to actually really refer to a different model, and I'm going to come back to that in a minute, about how we can embrace artificial intelligence. And it talks, I like this model because it actually really just reminds us of the different ways, the different types of artificial intelligence, I suppose. In a sense, we've got, on the right-hand side here, expert systems, which includes decision-making, drug interaction systems, care pathway planning. So some of us have those available to us in different aspects of care, not across all aspects of care, because some aspects of care are very hard to predict in terms of pathways. But we're increasingly seeing these expert systems coming to help guide our care. Robotics. So we know that there's surgical robotics, there's service robots, and there's rehabilitation robots available. And computer vision, which is really a type of AI which helps us to, how we can monitor patients, wound assessments, for example, gesture recognition. That's how computer vision and AI can actually help us to achieve. But probably the AI that we're really increasingly talking about because of the developments that have happened in generative AI in recent years really relate to this idea of machine learning. And that's really that subset of AI where systems learn different patterns of data and they can predict the decisions without being really explicitly programmed. So they actually just use data and they learn from machines. So, for example, that can actually be enable surveillance of can be supervised, can be unsupervised, but machine learning just really is looking at the data and looking at patterns. Deep learning, though, is a step up from that. And it's really about a more advanced set where it uses neural networks with many layers to model complex patterns in large data sets. So this is actually where they add these really additional sort of deep learning processes. And natural language processing, NLP, which is an area of AI that's focused on enabling machines to understand, interpret, and respond to human language. So that's that speech recognition, sentiment analysis, language translation. So some tools we're actually using in many, many different ways in day-to-day life these days, but increasingly in our practice. So there's different types of AI that are developing and rapidly developing that we need to understand. It's not all about just the ChatGPT that we need to understand. It's about a lot more. So here's some examples that are probably some of the most common ones that we think about in our nursing practice, and that's clinical decision support systems. They are AI-powered tools that provide nurses with evidence-based recommendations and alerts, help them to identify potential health issues early and make more accurate clinical decisions. So, those are some of the most common ones and some of the most useful ones that we're really seeing come into our practice today. And secondly, there is the predictive analytics. And that's the analytics that we're seeing that uses historical data, machine learning to identify the likelihood of future health outcomes based on case data. And the goal of that is to go the understanding of what we still see in our assessment to actually help us understand what will happen in the future. Now, of course, one point of caution I would say here, I'm going to talk about some points of caution in a minute. Predictive analytics is just that, it's a model. It's never going to be 100% accurate. So both clinical decision support systems and predictive analytics, fantastic. But the human is needed in this equation to be able to apply those clinical decisions systems to help make decisions. Because at the end of the day, we need to tailor our decisions to the different contexts and the different patients we see. Predictive analysis is just predictive. It's very few models can be 100% accurate. There will still be levels of uncertainty. It is just predictive. So again, the human needs to be in the equation here. What about generative AI? So generative AI is where there's a lot of hype at the moment. It's a type of artificial intelligence technology that can produce new content such as text, images, audio, video based on the data of GPT trained. So this is what's amazing. I was at a conference last week, the APAN conference, the Asia Pacific Association of Nursing Education, and one of the speakers actually put into one of the generative AI systems the theme of the conference and asked them to generate a music, a song for us. It was extraordinary. It was actually really quite just the theme and description of the conference and generated a lovely song which really reflected what the audience was there to learn at this conference. So it was extraordinary what it's able to do. So ChatGPT, of course, was the big milestone. It was the big thing, and it was actually really revolutionary. And some of my colleagues at QT where I work in robotics, that this has probably been the most significant advance in technology. And basically sort of really saying that it's so much faster than Google ever was, and following ChatGPT, of course, there's been others. But let's just pause for a minute and think, ChatGPT is the hype, but I've been around for a while, and I can remember other significant advances which changed what we do. I actually remember going from a typewriter to a computer, and again, everyone's sort of thinking, oh no, computers and would never going to take over the typewriter. I learned how to type. So I had to, live with it. Now, if you go back to the typewriter now, having said that, though, I bought my great skills to type, so I went to school. So I can very type on a computer, very quickly. Things which I remember, when Windows version. So I learned my statistical analyses and learning on SPSS on mainframe computers before Windows versions. So I remember having to actually write my own code and text. So I couldn't just press a button in Windows to tell me I want to do this analysis by this analysis. I had to write my own code and text. And I remember at the time, my supervisor saying to me, oh, don't want my students to use Windows because they'll become lazy. They won't think, they'll just run everything by everything. There was a bit of an element of truth in that. But having said that, though, it took me a lot longer to keep having to write my own text and write my own code. And I do get the point. And I think today we can actually take that type of analogy and see that that's similarly the challenges we're facing today. We can put things into ChatGPT or whatever Gen AI tool, and it can generate some information for us so much more quickly. That's fantastic. Is there some compromise that we need to have, though, in terms of how we also think about critical thinking aspects of that? Because I completely agree. I saw my other fellow students, the other supervisors, running everything with SPSS windows, whereas I still very carefully through what I was asking how. So some of my messages today are, we have to move on. This is an amazing advance, Gen AI. We also have to think about how we can embrace, and in particular, what does that mean for our nursing students and our nursing colleagues? So again, here's some of the issues we need to think about, and this is some of my points, common themes we're going to talk about. So, enhancing clinical decision making support is something that Gen AI can do for us. It can analyse clinical data quickly, providing nurses with handy, timely insights and recommendations about clinical decision making. However, answers provided by Gen AI are not always accurate, and it's important to verify information in credible sources. So, point number one here, we use Gen AI, we still need to have critical thinking. We still need to have knowledge, and we still need to know how to validate and verify and apply to individual contexts and systems. Similarly, Gen AI can improve documentation and administrative efficiency. Without a doubt, it can transcribe spoken notes into written documents, significantly reducing the time nurses spend on admin tasks. And it can also be used to assist in document writing, such as grammar and spelling checks. But again, it's not 100% accurate. And there's risks there, there's legal risks, ethical risks of us actually not checking and the accuracy of what Gen AI may do through some of these transcription tools. And of course, it's also claims that it can help provide personalised patient care by actually providing personalised health recommendation and coaching based on patient data, most notably chronic conditions. But again, there though, if we put our patients' data or patients themselves putting data into these Gen AI systems, there's some issues there that we haven't yet grappled with in our modern society. It's about confidentiality and personal information and who owns that information and the legal and ethical aspects of some of those issues. So there's some true traps here if we're not carefully implementing AI. Gen AI, of course, can enhance learning and training. So for those of us who are nurse educators, our nursing education is being transformed. It can create simulated learning scenarios very easily to assist nursing students and help them develop their critical judgment and clinical skills. And it is amazing how we can have avatars, how they can respond to cues that our nurses are doing. But again, though, these need to be understood in context of we need to develop those other skills that you must have to apply that to nursing practice. And of course, in nursing research and innovation, one of our AI tools are just really so helpful in terms of our data-driven research. We can actually use Gen AI to analyse large data sets of research, identify trends and outcomes and correlations, and drive innovations much more quickly than the coding and qualitative data. This data and these tools are extraordinary, particularly in how they're helping us to in qualitative research, analyse loads and loads of data, and in quantitative research, look at more sophisticated prediction analysis than modelling. But there are some challenges with Gen AI in nursing. And as I've referred to, there's things such as accuracy and reliability. Sometimes a Gen AI lacks the ability to recognise nuances or make complex decisions between pieces of information. And the result is biased decision-making decisions and incomplete or inaccurate answers. Secondly, I think that there's bias in fairness. So all models, such as ChatGPT, inherit biases for what the data that they draw. This is one of the most significant criticisms. The data is often in published literature, so that's actually positive trial results, not actually around where things actually haven't succeeded. And it can result in unfair and discriminatory outcomes. As we know, populations and samples in our research that we draw on are not necessarily representative of our population. So very Western bias, for example. There's ethical and legal issues that I referred to. So Gen AI can create content that's derivative of copyrighted works. We actually really haven't worked out what we do with that. Who owns that? And how do we actually manage that? And they're also trained on personal data, which poses privacy risks. So again, we need to be really, really careful when using AI in healthcare. That any, that patient data we cannot be used in Gen AI systems that actually can risk patient privacy. And of course, there's also just the practical integration of existing systems. This is so new, and we're all still struggling with just actually getting a basic electronic medical record in our health systems, aren't we? And so there's this challenge of adopting these into the system, but also challenge with the people part and how resistant we are to this type of change, because it's one more thing and one more complex thing that we need to work on. So, question that we really asked to ponder here today: will AI take over the role of nursing? Well, I think that some of the most recent papers, and here's another recent article in Nurse Now, which actually basically argues that the rise of AI will bring about a shift in the types of work that humans undertake, potentially transforming the nature of healthcare appointments. So the same as when things like the typewriter and computers came in and word processors, actually it's the type of work we undertake. So the sorts of ways in which we do things may change, and certain things that we do may change. But other things still require perhaps more honed and sophisticated skills. So this article argues that AI is taking over routine administrative and documentation tasks, and thereby frees us up to focus on what really matters. So one of the arguments that will take over the nursing role is, well, it may take over some aspects of things that actually takes away from critical thinking, from patient care, from really working to improve the outcomes of our community. And also, as AI continues to develop and take over more tasks, human employees will need to harness and leverage their human skills, such as relationship building, emotional intelligence, creativity, leadership, and critical thinking. So note those points. Nursing is really based, if you go back to that definition of nursing, it's based upon relationships. It's based upon critical thinking. It's based upon that passion, that empathy, that emotional part of what we do. So some might argue that in this environment, AI can really help us in nursing, because it's going to perhaps take away the things which stop us from doing those other things. So this article really argues we need to demystify AI and become fully engaged in development and implementation so that it works for us and it maximally benefits our ability to provide high quality patient-centered care. And therein lies one of the challenges. I have some of my colleagues at QT who are very much into health AI and tools. And one of the things we talk about often is that there's lots and lots of developments, but the users, the people who are going to use that in practice, are sometimes not involved in that conversation. So one of my messages for you today is to be actively engaged in this process. We really need to make sure that AI is being developed to help with what we do as nurses. And this is just a diagram. I know you'll be able to see this picture, but I just wanted to sort of show. This was from this same article looking at how AI is altering nursing work. And really the main point that I sort of want to say here is there's a whole lot of soft skills. Well, it's historically been called soft skills, and some people would say they're not soft at all. And they relate to things like thinking, they relate to things like negotiation, they relate to things like much more challenging collaboration. And nursing, particularly as you advance, so registered nurses, nurse practitioners, as you get to that more advanced, more and more you're on this soft skills side. And this article is arguing that that's the piece that AI is not really able to take over. So if we think about those aspects of our practice and how valued they are, it reminds us that we really have such an important role. So there's also been just a recent umbrella review, and I thought I'd just share this with you because I think the key messages, take-home messages from this umbrella review, all the data about the impacts of AI in nursing. Three main conclusions which they came up with. Firstly, the ethical and social implications underscoring persistent challenges that really highlight these persistent challenges in data privacy, bias, transparency. So all of the data is reminding us that there's so many ethical and social implications that we really still yet are trying to grapple with. So there's lots of challenge with privacy, bias, and transparency. And what that means is that it's often hampered by resistance because we're concerned about job displacement, the lack of standardised ethical frameworks. So we need to be part of that conversation to develop those frameworks is really one of the messages from this umbrella review. The second point that they made in this umbrella review, second summary point from the data, is that it is transforming this education and it's highlighting gaps in AI literacy and curriculum integration. So our key message from the review today again is, as nurse educators, we need to step up and understand how are we building AI literacy and curriculum integration, but not just within that framework that's ethical, and within that framework that's actually about literacy, which makes sure that we are using it effectively and appropriately. So, and summary points under this, or they really noted that things like virtual simulations or augmented reality, they're redefining how we think about nursing education, and they do give us different ways to teach critical thinking, clinical judgment, and personalised learning experiences. It's a fabulous environment out there. Not easy, and we've got to upskill. And yes, in some ways, so the resource implications are so significant, and the risks here are getting biased. There may be some countries and areas that actually, and courses that actually are better able to adopt these technologies. So we need to get inequities. We need to be conscious of that and make sure that we really lift all of the nursing education. The lack of standardised AI literacy programs and insufficient integration of AI concepts limit the preparedness of future nurses. We're really trying to catch up here. This is so rapid. We're trying to actually understand what are those AI competencies that we should be really thinking about. And of course, there's this risk of reliance on AI tools, which actually mean that if we're not careful, we will erode interpersonal skills. So it's not just about sending students off to augmented reality and thinking that they can learn from avatars, and it really is much more about how we can make sure that they're really still being authentic, working with people, and that we're actually assessing and providing feedback on those really, really important aspects of the 20 different situations. And the third point from this umbrella review was that we need to actually think about integrating, emphasising the need for ethical frameworks, stakeholder collaboration, and equitable performance. So that sort of summarises the points I've been making. Successful AI integration in nursing requires alignment between the technological tools, the organisational context in which they're deployed, and the nurses who use them. Not just about having some widgets and some AI tools, we absolutely need to make sure that our systems work to support it, that we understand nurses and their fears and their capabilities, and we really work with that. And the key point here is that integrating these associated critical considerations, such as workflow, such as involving nurses, such as putting ethical guardrails around this, will more likely foster positive attitudes and reduce resistance. And sometimes it's not about just it's rapid development, and we're not actually taking some time to think about how we actually involve nurses. So, what then are the competencies? So this is again an article, as I sort of said, we're beginning to understand what these are. This is referring back to an article that I mentioned earlier, which uses this nurses and acronym to talk about how we can guide and develop competencies. And I think this is a good starting point for us to think about how we can embed this to support our students to care, not just to really think that AI is a tool, but a technical thing that they need to adopt. Firstly, it's actually understand the competencies about understanding AI concepts. We need to actually help them understand that basics. So we don't need to be, we've got engineers, we've got engineering colleagues who know about machine learning, natural language processing, and data mining. However, we need to understand basic concepts and evaluate the capabilities and limitations of different tools. Data literacy is second competency. We need to consider being proficient in data interpretation and analysis. Again, I don't know how much we've done that in the courses so far. I need to really think about that as students, and including understanding of data sources, identifying biases, and evaluating data quality. So that critical understanding of data is so important. Ethical considerations, got to be very ethical implications of AI, such as privacy, bias, and the potential for job displacement. Thinking of problem solving always been important in medicine. But there is a risk in some of the research that talks about, does AI, when you use AI when teaching, does it actually take away from that critical thinking? Do people become almost lazy, if you like? And there is some interesting research coming out which sort of says there are some risks if you actually try to build in teaching still requires us to ensure that students do that critical thinking and problem solving. So actually support human decision making. It doesn't replace it. We need to be able to evaluate AI-generated recommendations and make informed critical judgments. Don't forget that, and that's what people think that, we can just have an AI bot and that's going to take over, but it's not. We still need that critical judgment at this point in time. And of course, collaboration and communication is another competency, an AI competency. And so we've got to work now with data scientists, engineers. We talked about collaboration with our colleagues in the health team, but now there's these other characters that we have to really understand how to work and speak the same language. Engineers and other professionals to develop and implement. So effective communication and collaboration is essential. So that's a really nice, I think, list of potential competencies that you should think about. Yes, so I just decided that, from my own, some examples from my own organisation, I've just taken, how we're sort of applying this in terms of advice to our students and staff at QUT. So here's just a website at QUT where we adopted our university's Microsoft Copilot as our recommended or as our approved AI tool for students. And so the advice we sort of say to students in terms of using Copilot or text generation is, yes, it can provide feedback on the quality of your writing, grammar, spelling, and it can also suggest improvements to layout, structure, phrasing, and sentence structure. It can summarize a large amount of information. It can produce practice tests, a variety of question styles, and it can help to overcome that fear of a blank page by providing a stimulus, and it can assist with time organisation. However, we also tell our students that limitations are the sources are not referenced or cited, and you're unable to see how Copilot has reached its answers. It can provide incorrect information with certainty, and that's what's known as hallucinations, and they're real. It may be too generic, contain biases, it can misinterpret the given prompt, and of course, copyright and data security considerations around input material are really, really important for students who need to demonstrate that they have learned. And we have sadly got students who get themselves into trouble by using AI without really understanding those limitations and how they need to deal with it. In terms of image generation, Copilot also does image generation. So again, possible uses might be creating unique images for your presentations. I'm going to show you some later on. It can turn concepts into images with little to no artistic ability or experience. I have no artistic ability, and it's amazing what Microsoft Copilot can do. And it can just provide some creative inspiration. However, again, there's unknown copyright, and the implications of copyright working with artists is used to train the model. We just don't know. Quality of images can vary, and making changes to an image can be difficult. So again, some real limitations. Some amazing benefits, but some real limitations. So they're just some examples from my own organisation of what we advise our staff and students. And here's just an example of what I mean. This was again, we have this on our website at QUT, where we actually show that how Gen AI tools can inherit the bias of their training data set. And for example, this was a prompt to generate the image of a doctor in a tool called Canva. And it resulted in 4 pictures, all older white males in lab coats. Again, a real bias that you can develop can really see that this is actually what it's trained in doing, so it is actually biased. So keep quite clear in terms of using AI tools carefully. And this is a statement from Albert Einstein. But basically, part of the getting quality output from AI tools, AI tools, is actually asking the right questions. So if you put something in generic, you're going to get lots and lots of information. It's going to be generic back. This is a really it's very well from Albert Einstein that I had an hour to solve a problem in my life depending on it. I used the first 55 minutes to determine questions to ask. AI is actually similar in that way. If we're careful about what we put in, then we're going to get, and it's the same as research, you know, you take some time to get the right questions, same in a systematic review that you might do. It's so super important. Don't just throw anything out there because you just get a bunch of stuff that's really not necessarily going to give you the best answer. And here's again from my organisation a tool that we use that my associate dean learning and teaching has developed, which is our digital capabilities tool. And she won an award on this in terms of basically underpinning this ethical and responsible and sustainable digital practices, and a range of different capabilities about proficiency and productivity, how to use information data and media literacies, how to create problem solving and innovation, communication, collaboration and participation, and digital identity, wellbeing, and so also looking at personal self. So we've got a capability framework that our associate dean learning and teaching has tried to embed across all of our tools, of our courses, to actually ensure that we're really building graduates who are capable in this very changing world. So again, going back to that first acronym, that article that I talked about from Missing Out, and here's what it's about. It's a lovely thing to talk about capabilities around literacy, how to navigate the basics, how to utilise it strategically, how to recognise its pitfalls, how to get skill support, ethics in action, and shaping the future of nursing. So again, it's a lovely acronym. So a quick guide that's actually in that nursing out paper that I commend to you to read. So in finishing then, I thought I'd just turn to Google AI itself to answer this question, which is how can we embed, my question was, how do we embed, how can this educator support AI skills? And there's really a couple of things that I highlight to. First was that how do we integrate into curriculum? So updating our core competencies. So we've been really getting what those competencies are and how do we integrate that using some of those references that I've given you before as a starting point, just beginning this journey. Developing dedicated modules or courses. So that's actually helping, to develop about specific aspects of AI. And of course, incorporating the ethics frameworks, where they integrate discussions about privacy, bias, accountability, and the importance of human oversight to ensure nurses use AI responsibly and ethically. So integrating the intelligence, and those are the sorts of things we should be thinking about. And then, of course, the other thing for nurse educators Google AI talked about was active learning and teaching strategies. So using AI-enhanced simulation and those platforms can really help student performance to practice complex critical decision making in a very safe environment. We need hands-on experience, so we need to let students experiment with actual AI tools and use AI technology and build confidence in a way that we're also getting them to critically think. So some of our assignments, for example, is that we might get students to use an AI tool in an assignment or assessment. We get them to provide a critique of its strengths and limitations. We use case studies and debates, so we can present real-world case studies, we can have discussion panels, we can have particularly things to ethical considerations and critical thinking. And of course, teaching active learning and teaching strategies encourage and build up literacy. So we're teaching nurses to generate AI interpretive insight, for example. So again, here's a fabulous little sort of, and people are really becoming very clever with how they're actually thinking about it. So this is one piece, which was the 5 rights. Everybody knows the 5 rights of medication administration, or more than that these days. But this is the 5 rights of AI. And again, here's, it's about problem population, the right objective, the right approach, the right competency, the right data, and the right safeguards. So all of those things, are really considered to be important in how we move forward. So lastly, my 2 last slides, I want to give note to something really important, and it's people find things. AI can be confusing, threatening, and challenging. So all that is a great opportunity for us, some real concerns we need to take and embrace, and they're complex ones and not easy to solve. So because it's confusing, threatening, and challenging, we need empathy, we need to show, we need to start information, they need guardrails and structure, they need transparency, they need professional development, and they need empowerment and involvement. Some of the concerns, that my staff have, they're all just taking over, they've got no control over what AI is doing. I actually think that we do have some control. It is changing, it is different. Yes, there's things which we need to, which perhaps are not in control about how this is growing. However, what we do have in our control, we need to understand. And that is building our confidence and capability, enabling us to think more critically, building those frameworks. And here I used Microsoft Copilot to develop this image of those points. I don't know, give you your moment to think, was that actually a good image or not? I actually don't think it was too bad. Balancing all of those things about what our team needs, I think. So it's not, it's an okay image, I would think. But it did it really in, less than 60 seconds. And secondly, I think I want to bring you back in my last slide. My last comment on the floor is bringing back to nursing and nursing practice. Nursing is underpinned by this unique combination, from that definition right at the beginning, unique combination of science-based discipline knowledge, technical capability, ethical standards, and therapeutic relationships. AI can't do the ethical standards, therapeutic relationships, and it can help with knowledge and help with the technical part, but we really need the human in the equation here. Nursing is committed to compassion, social justice, and a better future for humanity. Again, here's another image created by Microsoft Copilot. Not so sure that's good, but nonetheless, it's showing what's a tool at our fingertips now. My main message as I finish today is that this is change. We need to embrace change. However, we need to do so in a way that we are really critically thinking, that we're really taking on what's the best. How can this actually help us improve our patient care? I think there are many ways in which you can. But it's going ahead so rapidly. There are real concerns if we don't become involved, if we don't recognise what we can control, if we don't value those aspects of nursing that really make a difference to patient outcomes. So thank you so much for the opportunity again to present to you today. I wish you well for the conference. And really, I think, I'd be really interested to, I'm sorry that I can't take questions, but I'd be really interested to see how this space is going to evolve in the next few years. We're on a bit of a journey here. We need to embrace it. We need to take control of it. So I wish you all the best, and thank you again for the opportunity.
Ladies and gentlemen, allow me to read the conclusion from Professor Petzitz. Nursing is a profession dedicated to upholding everyone's right to enjoy the highest attainable standard of health. AI in nursing can transform the field through branches such as machine learning, deep learning, natural language processing, robotics, and computer vision. Therefore, it is essential for nurses to continue embracing technological innovations while upholding the core values of the profession. Thank you so much for your attention. I will now return respectfully to the Master of Ceremony. Wassalamualaikum warahmatullahi wabarakatuh.
thank you for Professor Cassius for the rising insight, and thank you once again to Anidia for moderating this session. Teman-teman, sebelum kita next ke materi selanjutnya, teman-teman bisa berdiri untuk exercise atau peregangan terlebih dahulu agar tidak mengantuk dan juga cool down. Boleh berdiri. Boleh dimulai untuk peregangan teman-teman agar tidak pegal dan mengantuk. Apabila mengantuk, boleh langsung saja ke toilet di samping kiri. Baik, apabila sudah boleh duduk ke tempat masing-masing kembali, teman-teman. Anjing, dianduk kene kita. Dianduk kene. Miss Nyayu Nina Putri Chalisani, PhD, lecturer of our institution, who will be sharing her expertise on Ready for Anything, how VR helps us practice disaster skills. This session will be moderated by Mita. Please allow me to read Mita Curriculum Vitae. Mita Sri Rahayu Kencana. She is a Bachelor of Nursing student currently studying at Stikep PPNI Jawa Barat since 2023. Her achievement become a member of Student Executive Board at 2024 until present. Become a member of UKM Unit Protokoler Mahasiswa at 2024 until present. For my beloved friend Mita, the floor is yours.
Thank you very much for Master of Ceremony for the warm introduction. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, and greeting of virtue, peace be upon us. Dear guests, respected speaker and all participants, welcome to the International Nursing Student Symposium. First of all, let's thanks to Allah Subhanahu wa Ta'ala for allowing us to gather in this hall. My name is Mita Sri Rahayu Kencana, and I'll be your moderator today, and I'll lead this event and make sure everything runs smoothly. Let me start by introducing our speaker here today, Mrs. Nyayunina Putri Chalisani, PhD, a lecturer our institution. Allow me to read her curriculum vitae. Nyayunina Putri Chalisani, PhD, from Stikep PPNI Jawa Barat. Her awards: visiting professor, a public speaking community service, the influence of food message on blood pressure and anxiety in hypertensive patient, influence of health education with the digital module on disaster preparedness in community, and her research focus in extension of PTM, non-communicable disease, at Bindu PTM Nusa Beautiful, counseling on community service activity, walking for help, at Asih Village, Cisarua District, West Bandung Regency, and her publication, Influence of Health Education with the Digital Module on Disaster Preparedness in Community. Okay, without any further ado, let's start our next session with the theme Ready for Anything, How VR Help Us Practice Disaster Skills. This session will explore how virtual reality can support nursing students in developing essential disaster response competency in a safe and controlled environment. Okay, please give your full attention and big applause. Welcome, Mrs. Nyayunina Putri Kalisari. Okay, how are you today?
I'm fine.
Okay, are you ready for this presentation?
Yeah.
Okay. Okay, before we begin this session, allow me to inform our presenter regarding the time allocation. Ms. Nyayu, the total time provided for this session is 45 minutes.
Yes.
This is including the answer and question segment.
Okay.
Okay, and we hope this help is managing the presentation effectively.
Okay. Thank you, moderator.
Okay.
Yeah. Good morning, everyone. I think not afternoon, yeah, because it's not yet 12. Yeah, on time. Yeah. Yeah. Morning, everyone. I am Yuna Putri Jayasani. Welcome to our general lecture title, Ready for Anything, How VR Help Practice Disaster Skill. Today, we are going to explore how virtual reality or VR can be used practice disaster skill for nursing student. Because nursing student like you for real world emergency. As future healthcare, uh, as future healthcare professional, you will not only deal with daily nursing tasks, but also unexpected high pressure situation where lives depend on your readiness. In this session, we will discuss how VR bridges the gap between theory and real life practice. Yeah, preparing future nurses for real world emergencies. Virtual reality or VR is transforming the way nursing students are trained to respond to real world emergencies. Traditional training methods, for example, lectures, tabletop exercise, and occasion occasional drill, often can full recreate the chaos, urgency, and unpredictability of uh, actual disaster situation. VR provide a safe, immersive, and repeatable environment where students can practice essential skill. Why VR matters for future nurses? First, bridging the gap between theory and practice. Second, exposure to high risk, low frequency event. Third, developing emotional readiness. Four, strengthening confidence and teamwork. Five, safe space for mistake and reflection. Today, uh, we'll explore how to virtual reality can transform the way we prepare for disasters, helping future nurses practice safely and effectively. Yeah, the reality of disaster. First, disaster can happen anytime and anywhere, and healthcare workers are frontline responders. Preparedness means confidence and competence. The problem with traditional training. First, limited realism in classroom exercise. In traditional classroom-based disaster training, realism is very limited. Most exercise rely on lecture, verbal scenarios, or simple demonstration. While this method introduce concept, they do not reflect the chaotic and unpredictable environment of real disaster. Second, difficult to simulate stress and urgency. Traditional training struggles to replicate real emotional and physical stress in actual disaster. Responders face adrenaline, confusion, competing priorities, and pressure to make a fast decision. Third, risky and costly to organize real drill. Realistic full-scale drills require large resources, actors, equipment, logistic, safety times, and coordination with various agencies. These drills are expensive, consuming, and can be done frequently. What is virtual reality? Virtual reality is a technology that create a three-dimensional environment generated entirely by a computer. This environment may resemble a real world place such as hospital, disaster sites, or emergency rooms, or represent custom simulation scenario. Second, learners interest as if physically present. With VR headset, learners feel physically present inside the virtual environment. They can move, look around, observe details, and perform tasks using handheld controllers. Third, interactive and immersive learning. VR creates in an immersive learning experience. Learners are active participants who practice procedure, make decision, and respond to scenarios realistically. Yeah. How VR work? Disaster education. First, recreate emergencies setting. VR law, uh, VR law to VR law education, VR law to education to recreate uh, realistic emergency environment similar to actual disaster situation. This environment may include collapsed buildings, mass casualty incident, fire hazard, flooding, or chaotic emergencies rooms. Second, practice triage, evacuation, and teamwork. VR enables learners to practice real action such as triage, injuries assessment, prioritizing care, and decision making. Learners can also practice evacuation routes and teamwork within a shared virtual scenario. Third, real-time feedback and on performance. VR system can track accuracy, response time, and adherence to protocol, providing real-time time feedback. Learners can repeat scenarios until mastery is achieved. Benefit of VR in disaster preparedness. First, safe practice of high-risk scenarios. VR make is possible to safely practice scenarios that are too dangerous, expensive, or unrealistically to recreate in real life. Learners can respond to explosion, collapse building, mass casualties, toxic exposure, or fire hazard without any physical risk. Second, realistic stress and urgency. VR create and cognitive stress similar to a real disaster through alarm, loud noises, chaotic scenes, and time pressure. This trains learners to stay calm, make quick decisions, and build resilience. Third, repeatable and engaging learning. VR scenarios can be repeated anytime without uh, VR scenario can be repeated anytime without needing complex logistic. It immersive, interactive, interactive nature increases engagement, retention, and long-term competency. For instant feedback and self-reflection. VR tracks learners performs in real time, including accuracy, recurrence, speed, communication, and protocol adherence. Intense feedback allow continuous improvement and skill mastery. Nursing scenario using VR. First, earthquake hospital evacuation. VR simulation a hospital shaken by an earthquake, allowing nursing students to practice rapid assessment, evacuation prioritize, and patient movement. Second, mass casualty. Scenario includes a chaotic environment with multiple victims. Student practice triage using start all SAT. Third, fire response and patient relocation. Student practice race protocol, pass extinguisher technique, and patient relocation during fire. For outbreak control and infection prevention. VR simulation, infection outbreak for IPC practice, PPI use, isolation and facility control. Evidence and research finding. First, improve knowledge retention and decision making. VR-based learning significantly enhances memory retention, application of clinical algorithm, and rapid decision making in high pressure scenario. Second, enhances teamwork and confidence. VR support collaborative learning, improving teamwork, communication, and confidence when facing emergencies. Third, Smith et al. 2023 found that VR trained students score 40% higher in disaster readiness. Student experience, first, it feel real. Uh, I forgot it was a simulation because VR create a high level of realism with sounds, alarm, vibration, and visual chaos that trigger genuine emotional response. Second, I learned to manage peer and focus. Students learn to control fear, confusion, and urgency through repeated exposure to high-risk scenarios. Third, it was intense, but it made me confident. The intensity of VR scenarios helps students build confidence in triage, assessment, and leadership. Integrating VR in nursing curriculum. First, complements clinical practicum. VR enhances and supports clinical practice by preparing a student with exposure to complex and high-risk scenario before entering real clinical setting. Third, integrated into emergency and communities course. VR scenarios are incorporated into disaster nursing, emergency care, community health care, and public health preparedness course. Third, use for assessment and reflection. VR performs data for formative and summative assessment, including decision making, speed, protocol accuracy, and timework evaluation. Challenge, challenge, challenges of VR implementation. First, high setup cost. Implementing VR requires investment in headset, high performance computer, software, and maintenance. Second, technical support required. A VR system need continuous technical support for installation, troubleshooting, and updates. Third, motion sickness risk. Some users may experience dizziness. Some user may experience dizziness or nausea due to sensory mismatch or long exposure. Four, must follow national disaster protocols. VR training must align with national disaster protocol to ensure accuracy and safety. Ethical and safety consideration. First, ensure psychological safety. VR disaster simulation can be intense. A student may feel stress or anxiety, so psychological safety must be uh, prioritized. Second, protect data and recordings. VR system often records users' action. Data must be secure, scripted, and accessed only by authorized staff. Third, always debrief after simulation. Debriefing helps students process emotion, review decision, and reinforce learning. The future VR in nursing education. First, AI powered adaptive learning. AI enhance VR by personalized difficulty, adjusting patient behavior and providing tailored feedback. Second, mix reality MR environments. MR blends digital and real world elements, enabling interaction with real equipment and holographic overlays. Third, global collaborative training. VR will allow international students to join select simulation, improving global teamwork. Four, affordable VR kits for wider access. Cheaper and portable VR kits will expand access to low resource nursing institutions. Ya, this is my VR. Gimana ya? Gimana kliknya? Bisa diklikin ya? Bukan. Diklik.
dalam keadaan darurat. Wow, telah terjadi pribadi UTS dan terdapat 7 beban. Tolong dibantu segera. Perhatian kepada semua yang dapat pada sekolah ini. Saya adalah tim bertolong yang akan membantu Anda. Jika Anda mendengar ini dan berjalan, kami meminta Anda untuk berjalan dengan tenang dan untuk suara saya.
Ya, eh belum selesai. Ya, key takeaways. Disaster can disaster are unpredictable, and VR help prepare students to respond quickly and effectively. Yeah. Second, VR builds confidence, teamwork, and resilience. VR strengthen clinical and emotional resilience, improving teamwork and decision making. Third, train hard, fake easy. Intense training prepares learners for real world emergency. Kenapa nggak bisa? Ya. In time of crisis, we don't rise to the level of our expectation. We fall to the level of our trainings, and this quote highlights that in real emergency, people rely on what they have practiced, not what they hope they can do. Training builds automatic responses under pressure, aligning perfectly with VR disaster simulation. Question? Any question?
Okay, right. Thank you, Mrs. Nyayu, for the great and insight presentation. Now we'll begin to answer and question session. Okay, for the first, just one question. I'm sorry, Miss. Never mind. Okay.
Good afternoon. Let me introduce myself first. My name is Muhammad Rizky dari from Stiker PPNI. I have a question for you, Miss. May I? The question is, how can VR effectively simulate stress and urgency, and why is this crucial for disaster skill development? Thank you.
Yeah, thank you for question. You, yeah, what can simulate and stress and urgency? Uh, VR can simulate VR can simulate stress and urgency by creating realistic disaster environments. Chaotic sounds, time pressure, and unpredictable scenarios change. This allow learners to feel real emotional pressure. This is crucial because in disaster, in real disaster, healthcare healthcare provider must make a fast decision, stay calm under pressure, and work work effectively as a team. VR enable safe practice of this critical skill without real risk. And for conclusion, virtual reality gives us a powerful and innovative way to prepare for real life disasters. By providing safe, immersive, and realistic simulation, VR help nursing students practice critical skill without facing actual danger. This technology not only improve our readiness, but also builds confidence, strengthens decision making, and support effective learning. Thank you.
Okay, one question again. Okay. Okay. Before that, thank you so much for your presentation, Mrs. Let me introduce myself before I ask a question. My name is Putri Alicia Maria Rasima. I'm from Budi Luhur Institute of Health Sciences Cimahi, and I want to ask a question. Today, the first time I heard about virtual reality for disaster, and it's so amazing innovation that I ever heard. But I want to ask something. Is it more effective to use virtual reality before? Is it effective to using virtual reality than role play in real life? Beside the price of VR is quite expensive than role play in real life. How to approach? What approach to deal with it?
Yeah.
Thank you so much.
Yeah. Yeah. VR is effective for for apa namanya teh? For uh, student use because uh, if a student uh, only learn apa tadi only learn uh, role play ya only learn role play student can be apa ya can be uh, can be can be feel real emotional because in apa nih virtual reality student um, must make kacamata VR and use kacamata VR student can real emotional by the game VR but if only if only if only play role play student uh, only learn scenario can cannot feel real emotional if use VR yeah yeah.
Okay, thank you for the question. As our time has concluded about VR offers as a safe and realistic way to practice disaster response, helping people build confidence, make better decisions, and react effectively when real emergency occur. Thank you very much, Mrs. Nyayu, for presentation. It's inspiring for all of us, especially about virtual to Miss Dewi. Thank you for this, Dina. This is certificate for you. Thank you for sharing this information for our students for Okay, thank you very much, Miss Dewi and Mrs. Nyayu. Okay, thank you to everyone for the question and intention. Now I would like to return the session back to our Master of Ceremony. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much to Mrs. Nyayuni Naputi Karsini, PhD, for the outstanding and insightful presentation. And thank you to Mita for moderating the session smoothly. Ladies and gentlemen, we will now take a break for 1 hour. During this time, we invite all participants to enjoy the refreshment that have been prepared. Please return to the venue on time as our program will continue immediately after the break. The symposium will resume with the next session presented by Dr. Neil M. Martin. Once again, please enjoy the break and we'll see you back here in 1 hour. Sebelumnya teman-teman diinfokan jangan dulu untuk keluar karena akan dibagikan konsumsi. Dan nanti teman-teman akan kembali lagi ke dalam ruangan pukul 1 pas jam 13.00 waktu Indonesia bagian Barat. Untuk teman-teman, mohon untuk kondusif apabila sedang sholat gitu ya. Untuk musola ada di 1-3 dan juga kami menyelenggarakan bazar apabila teman-teman ingin sekalian untuk jajan di depan. Udah, Bapak.
Default. Nag-break pa siguro sila.
Jadi nyalainnya gitu nih. Jangan lihat bakal ini. Peningnya di mana? Terus duduk. Tiba sini. Terus lalu apa? Berapa menit Pak? Halo?
Hello, good afternoon. I'm trying to open my camera right now. I apologize. Maybe there's something wrong, but I'll just have it checked first.
Okay, doctor. Ladies and gentlemen, welcome back to the International Nursing Student Symposium. We hope you had a pleasant and refreshing break. We will now continue with lecture session 5 presented by Dr. Neil M. Martin, who will be sharing his expertise on caring for the mind, supporting mental health through simple digital approach. This session will be moderated by Lydia Manda. Before we begin, please allow me to briefly read Lydia Manda curriculum vitae. Lydia Manda Putri Belani, she is a Bachelor of Nursing student Stikap PPNI Jawa Barat in 2025 and 2024 until present. Her achievement is being volunteer TEDx Bandung, Bandung Lautan Api Courage in Every Flame in at ages 2025. She's being volunteer Suka-Suka Puan, being project officer in September until present. For my beloved friend Diamanda, the floor is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. Shalom, Om Swastiastu, Nama Budaya, and greetings of virtue. Peace be upon us all. Thank you very much to our Master of Ceremony to warm opening. Dear distinguished guests, respected speakers, and esteemed participants, now we will proceed to our fifth session of International Nursing Student Symposium 2025. My name is Lydia Manaputri Belani, and I have the honor to serving to moderator this session. I will guide you throughout this program and ensure that our session runs smoothly. Ladies and gentlemen, it is my great pleasure to introduce our esteemed speaker, Dr. Neil Madulara Marvin, PhD RN, from Mindanao State University Iligan Institute of Technology, Philippines.
Hello, good afternoon, everyone. Am I allowed to share my screen?
Sure.
Yeah. I wonder if you can see my screen now. Unfortunately, the laptop I'm using now cannot detect a camera, so I apologize for that. But I wonder if you can see the slides projected on screen now.
Yes, Doctor.
Yes, okay. So, ladies and gentlemen, good afternoon. Apologize. Definitely, you cannot see me on camera, but good enough that the material is being flashed right now. So I hope that will be helpful for everyone currently online for this presentation. So I would like to congratulate first the organizers and the university partners and the hosts for this 2025 International Nursing Student Symposium with the theme Future Ready Nursing Students, Caring Skills, Technology Skills, and Life Skills. Um, Hold on. So the topic that I'm going to bring about to you, as shown in the screen right now, is caring for the mind, supporting mental health through simple digital approaches. And I thank you for the kind introduction done earlier by the moderator. And I'm pleased to meet you online, though you cannot see me on screen. And I would like to thank Astri for facilitating this and understanding my circumstance right now. I'm currently at the airport and just arrived from Taiwan. And hopefully, you will consider some mistakes or flaws in this presentation. So you can see on screen right now, at the left is Neil Armstrong, and at the right is a robot with an AI mark, and it's actually like moving forward. So I would like you to think about that from the time 1969 up to the present, we are still in the process of understanding what's going on around us, and that this will help us prepare ourselves, especially for future ready nursing students in the care with their skills, particularly on caring, technology, and life skills. So this is very important. And to sum it up, you're actually looking forward to develop certain competencies to address this future readiness among you and responding to the healthcare needs of the world. So the outline of my presentation includes greetings and disclaimer, objectives and introduction or terms of reference. And then I will focus on here caring for the mind, supporting mental health through simple digital approaches, and then our conclusion and ways forward. So this is our university, and we are known to be under the THE or the Times Higher Education World University Ranking 2025 in Asia, and we are number 601 plus in the Asia University Ranking. And this is what we actually identify ourselves with the hashtag MSUIIT influencing the future. And you can visit us in our website, www.msuiit.edu.ph. My name is Neil Madulara Martin, PhD RN, a clinical instructor, international affairs coordinator designate, College of Health Sciences, Mindanao State University, Iligan Institute of Technology, Mindanao, Philippines. I also would like to introduce to you our Chancellor, Professor Dito Kalan, and he actually is introducing to us the so-called hashtag MSUIIT influencing the future. And then I would also will wish to introduce you to our Vice Chancellor for International Affairs, Dr. Joey Genevieve Martinez, together with his staff. This is my second office other than the Faculty of or College of Health Sciences. And then in our university, we are identified to be, or we're considering ourselves some of the cats. And then we are introducing our university mascot named Alab. So if you happen to visit our university, then you can actually find him, or like you can find the mascot around, especially on special occasions. And then around us are cats, live cats that you can actually cuddle, you can actually play with them, feed them, and then just be with them, because this represents our university as having the passion and fire for commitment and dedication towards higher excellence in education. We're also introducing our hopefully new building, and then by 2 years from now, then we will be housed in this building, and then it will be transferred to a new campus. So hopefully, any one of you can visit us. Will see this structure that will house our high fidelity model in our nursing laboratory. I would like also to introduce our dean, Dr. Minnie Mamawag. She is a doctor in science and nursing, major in gerontology. And together with the faculty, we say MSU is love. And altogether, as College of Health Sciences, we dare, we care, and we share. So I declare no conflict of interest, and the materials included in this presentation are findings of literature reviews, open educational resources properly cited. Here's my objective. There are three items that you'd like to focus into along the online presentation. You will be able to familiarize terms of references used, and then eventually introspect on key concepts of caring for the mind, supporting mental health through simple digital approaches, and translate, that's the third one, the concept into a given actual work case scenario. First and foremost, maybe all of you can see the screen now, and please identify yourselves feeling today. Maybe some of you are really great with this icon or emoticon, or some of you are pretty good feeling. All right. Maybe you can chat, what do you feel today? And then third would be okay, I guess. Or number four, emoticon would be starting to struggle. Anyone who's starting to struggle this time? Or having a hard time? And lastly, you're saying that you need support. So this is what I meant by mental health check-in. So every day, maybe yourself, and maybe you also have a close friend or classmates or even family members, then maybe you can also do routine mental health check-in from time to time. All right. So I hope you are in the best state of health and you are safe in the place wherever you are. I would like you to take a moment right now and just focus your attention to the circle and try to relax yourself, take a deep breath, and then be happy. Okay. And just feel relaxed as we go on with the session. So, can we do it together? One, two, three. All right. So, you breathe in one, breathe in out, then breathe in two, breathe out, breathe in, and breathe out. So if you do this routinely, then maybe this would help you be relaxed and be focused on the items that you are doing in the house, in school, or wherever you are in the community. So more than 1 billion people are living with mental health disorders, according to new data released by the World Health Organization, with conditions such as anxiety and depression inflicting immense human and economic tolls. While many countries have bolstered their mental health policies and programs, there is a need for greater investment in actions that are needed globally to scale up services to protect and promote people's mental health. So you can see in this slide, a person is actually like blowing into a brown bag. So this is actually our nursing responsibility, or maybe like a common practical way of maintaining breathing techniques while you are under stress or you're hyperventilating. All right. So, and maybe on the other hand, you are into depression or you know someone who are in the depression state. So, mental health conditions such as anxiety and depression are highly prevalent in all countries and communities, affecting people of all ages and income levels. They represent the second biggest reason for long term disability, contributing to loss of healthy life. And they drive up healthcare costs for affected people and families while inflicting substantial economic losses on a global scale. Transforming mental health services is one of the most pressing public health challenges, according to then WHO Director General Dr. Tedros Adhanom Ghebreyesus. He further said that investing in mental health means investing in people, all right? Investing in communities and even in economies, which is actually an investment no country can afford to neglect. Every government and every leader has a responsibility, and even yourself, to act with urgency and to ensure that mental health care is treated not as a privilege, but as a basic right for all. I hope you will agree with that. Okay, so show me a thumbs up in the chat box if you agree that it is mental health care is a basic right for all. Okay? So in this case, the economic impact of mental health disorders is staggering. While healthcare costs are substantial, the indirect costs, particularly in lost productivity, are far greater. Depression and anxiety alone cost the global economy an estimated US dollar of 1 trillion each year. And these findings underscore the urgent need for the following. Okay, take note of this. Number one, sustained investment. Number two, stronger prioritization. And number three, multi-sectoral collaboration. This is to expand access to mental health care. We also would reduce stigma and tackle the root causes of mental health conditions. Okay, I hope you got it. So these are the findings of the write-up by which it talks about or focuses on mental health disorder and that requiring an urgent need to address such concern. Okay, so um, hold on. Okay, so here the next slide is giving us the update on the Comprehensive Mental Health Action Plan from 2013 to 2030 that builds upon its predecessors and set out clear actions for member states, the World Health Organization Secretariat, and international, regional, and national partners. This is in the hope of promoting mental health and well-being for all, and you are included in that. Another one is to prevent mental health conditions for those at risk and to achieve the so-called universal coverage for mental health services. So this is what the material is all about and is available on this site. I have actually included in the slide. Okay. So moving on, hold on. While the updated action plan includes new and updated indicators and implementation options, there are original four major objectives that remain unchanged. Okay, I repeat, original four major objectives that remain unchanged. More effective leadership and governance for mental health. And then the second one is the provision of comprehensive integrated mental health and social care services in community-based settings. I hope you have been exposed to the community setting, and I hope that you're able to appreciate the need for effective leadership and governance for mental health, the provision of comprehensive integrated mental health, and social care services in community-based settings. This activity that you are doing right now online is part of those services in community-based settings that hopefully will reach out to people who are actually confronted with mental health conditions or issues. And this implementation of strategies includes promotion, very important is promotion. That's our role as nurses, and prevention and strengthen information systems, evidence, as well as research. Who among you here loves research? Anyone? Can you give a thumbs up when you love research? Because definitely, as nurses, we will be working on with certain evidences, all right? And that it is through research. Okay? So caring for your mental health, that's another item that I'm going to bring up to you. In the slide, you can actually see be kind to your mind. So, what does it include mental health? It includes your emotion, it includes your psychological condition, and social well being. So, these three is very important, and that maybe you could always hear that when we care for our patients or we care for someone, it must be holistic. So definitely this includes emotional, psychological, and then social well-being of an individual other than the physical and the spiritual aspect. So it is more than the absence of a mental illness. It's essential to your overall health and the quality of life. And we can actually claim that self care can play a role in maintaining your mental health and help support your treatment and recovery if you have mental illness. Okay, I repeat that. Self care can play a role in maintaining your mental health and help support your treatment and recovery if you have mental illness. So here it says self care is healthcare. So when we talk about self care, it means taking time. What do we take time for? So we take time to do things that help you live well and improve both your physical health as well as mental health. And this can help you by managing your stress, by lowering your risk of illness, and by increasing your energy. Okay, I think you have the idea on how you manage stress. Just like what I started earlier, you can just take a pause and then just calm yourself and take a deep breath. You breathe in and breathe out. Okay, so if we care for our patients, then we also teach them how to do the deep breathing exercises so that they'll be able to relax themselves and lessen the pain if they are in pain. All right, that's managing stress. Number two is lowering your risk of illness. So when you try to lower your risk of illness, then you're trying to prevent by maintaining or promoting health and then doing practices that would also improve health rather than illness. And of course, improve your stamina or your energy. So even small self-care in your daily life can have a big impact. Okay? So moving on, there are some self care tips that I'm going to share to you. And that number one is to get regular exercise. So I wonder if all of you go into a 30-minute walk every day. This actually can boost your mood and improve your health. Or maybe some others are doing certain sports like basketball, volleyball, and some other form like workout in the gym or like even workout at home, then that would be something that would be very helpful to get you into regular exercises each day. Small amount of exercise add up, so don't be discouraged if you can't do 30 minutes at a time. Maybe you can get started with a few minutes first, and you can have 5 minutes and then move to 10 minutes and then 15 minutes and then so on. All right. I hope we're clear with getting regular exercise each day. The second one is to be eating healthy, regular meals, and stay hydrated. Okay, I think you can best relate on this. Now, a balanced diet and plenty of water can improve your energy and focus throughout the day. And pay attention to your intake of caffeine because if we are going to consider more intake of caffeine and alcohol, they affect your mood and well being. For some, decreasing caffeine and alcohol consumption can be helpful. Now, um, the third one is make sleep a priority. Okay. So if you're going to look into sticking to a schedule and make sure you're getting enough sleep. Okay. So maybe you can type in how many number of hours sleep you had last night. Okay. Can you type in with that? Okay. So, you need to take some time to prioritize scheduling and making you're getting enough sleep. And then blue light from devices and screens can make it harder to fall asleep. So reduce blue light exposure from your phone or computer before bedtime. All right? At least 2 hours before bedtime, then you can relax yourself from the blue light exposure. All right? So I hope that's clear, making sleep a priority. Then follows try a relaxing activity. All right? So as you can see in this screen, well, a lady is taking a bubble bath. Maybe it is a warm bath as well, so it's more relaxing to the body. And you have your own time in silence, and you just have to be calm. And then maybe you can add up with certain scents that you like. And then maybe you can actually like have a music, the ambient music, maybe, or your kind of music that will relax you. So this is actually to explore relaxation or wellness program or apps available in your phones and on the Nine or internet and may incorporate meditation, muscle relaxation, and breathing exercises. Okay? And then schedule regular times to this and other health activities you enjoy, such as listening to music, reading, spending time in nature, and encouraging in low stress hobbies. Okay, so I hope that's very clear, making sleep a priority and trying a relaxing activity. Now, well, we need to set goals and priorities, meaning you have to decide what must get done. Learn to say no to new tasks if you start to feel like you're taking on too much. Okay? Learn to say no. Not at all times, yes. Especially if you cannot handle the situation. And then try to appreciate what you have accomplished at the end of the day. Okay? So it's setting goals and setting priorities as well. Now, the next is practice gratitude. So remind yourself daily of things you are grateful for. Be specific and write them down or replay them in your mind. Okay, that's very important that, in building up resiliency, you have to be grateful in every day that you are encountering, then you just have to be grateful for all the things that is happening to you. All right. So I have found out an article, and the source is actually shown in the screen. It's available on the slide, and I would like to bring to you some highlights with regards to the third topic on trying to make use of simple digital approaches. Okay, the article shares about digital interventions that reshape mental health care with both promise and challenges. All right, so maybe you're familiar now with AI. So I'm a user of AI in my phone, and then I'm also a user of my iWatch, by which the iWatch that I use is actually featuring chatbots, and that will lead me to some tips on whether I am sad today, I am depressed today, or like certain things that I am given the instructions on what to do. Like if I am sitting more than 30 minutes, then it will give me a prompt to stand up and then take a deep breath. So these are a few of the things that you may be able to appreciate in the use of AI, some forms of wearables and virtual realities that expand diagnostic capabilities in psychiatry. And then very important is the third, your ethical concern, including data privacy, transparency, and regulatory oversight. All right. Okay, that's the third one. And then the last one is the tequila framework outlines key factors for responsible. So this tequila framework addresses trust, evidence-based, quality, usability, interests, and then liability and accreditation. So it's not just like making use of all these tools available, but we have to consider certain forms of ensuring data privacy, security, transparency, and AI-driven decisions along with evidence-based. Very important are articles that you have read with scientific basis, and that will be your basis for certain forms of interventions. That will be regulatory oversight to maintain certain interventions. And then quality, usability design that is tailored to diverse needs and ethical alignment with the users. And then your interests will all be essential, while liability and accreditation will follow standards that will safeguard accountability in involving the landscape. So digital media characterize our lives together in many ways. Like they promote global networking, enable unprecedented access to knowledge, and very important is educational materials. So examples of these are digital platforms such as e-learning tools. I think you're using that, especially during personal communications. So just right now, even with some glitches, we are connected because of internet, because of some platforms available online and in our phones. And that is what it takes to appreciate digital media in as part of our care among our patients and ourselves. So, like, say, for example, we consider the field of mental health care. So, you're familiar with telemedicine, I suppose, and there are other health applications available. So, this improve or promises improve access to care, especially for those who are far flung or away from the city or in the mountainside, or it's kind of far that is actually needing some help when there is what we call mental health crisis. So online, maybe we can actually have some initial efforts to reach them out, and that improves access to care. Then the greatest hope is probably to improve access to psychiatry and even psychotherapeutic care, and especially in regions with limited services or the young people like yourself who have difficulties. If you remember the mental health checkup or check-in, there is what we call like, I need support. I am struggling. So with that, with the access of psychiatric and psychotherapeutic care, you're not alone. Although you're online, you can actually reach out to a friend and then you can talk about if you trust him or her, then you can talk about your feelings, your condition, then you can keep in touch with each other. Okay? And this is also in the thought of intervening early and at low threshold before crisis escalates and become chronic, putting the permanent strain on the system. This is in accordance with the article by Mark Gory et al. In 2024. And then ideally, prevention, diagnosis, and treatment of mental illness is flexible, cost effective. And these are actually with reference to the use of scalable, I repeat, scalable mobile applications. And then this article, the last article, is looking into culturally and linguistically adapted, especially on certain needs by a certain group, by a certain culture, subculture like age, gender orientation, and accessibility of independent and respected locations. So this is according with Ebert et al. In 2019, Paganidi et al. In 2018, and Robinson et al. In 2016. And of course, Spanhel et al. In 2021. So let's look into some vulnerable groups in particular who often fall through the cracks that require targeted interventions that leverage digital media. So, what will include the digital media? You have your television, your radio, your website, your social media, your emails, your SMS, and then your mobile application, and then your blog, and then your podcasts. Or perhaps you can go into TikTok, Instagram, and some other forms. Now, that's something that you can actually leverage with in your nursing care, all right, especially on health education, and that you have actually invited your co-students to participate in your contest, right? So these are forms of engagement, social in the social media platform and in a social media community. So that's very important to consider, and that's what you're doing right now. So accordingly, the market of telemedicine and health application is currently experiencing an explosive upswing and driven by the increased demand for flexible healthcare solutions and intensified by the coronavirus pandemic, which is leading to the rapid growth in the availability of advanced technologies and telemedicine. This is according to Linardon et al. In 2019. And there is a forecast that indicate this market will continue to flourish in the coming years, supported by innovative solutions such as video consultations, remote monitoring, and medical application. This is according to the study of Mikolik in 2022. And in 2022, more than 50,000 M-Health offers were available for download in the App Store and Google Play Store. This is according to Mikolik 2022 study. And most of these offers relate to psychosocial well being and stress management, with only 2.08% of these publicly available mobile applications having published evidence of effectiveness, according to Baxter et al. In 2020 and Lau et al. In 2020. So a projection has been made through the study of Statista.com that by 2025, the global mobile health application market is expected to increase from US $2.4 billion in 2017 to 11.2 billion US dollar. Okay? So it's actually expected to increase and getting high. So I'd like to share to you to support all these claims that we are now into digitalization in terms of caring for our mental health. And we can actually participate on this. But definitely, there is no substitute for a face to face encounter of our patients requiring mental health support. Okay, so in supporting mental health, self care discovery through a chatbot can also be of help. As I have said earlier, I've been using an iWatch, and it helps me when I am down. I just have to press something like the chatbot prompts, and then it will lead you to something, or it would lead me to something helpful for me to do meantime that I'm not really in good state of mental health. Okay, so maybe you could also you have experience already chatbots, and in the university that I worked, there are available chatbots in our email within the system of the university where our students can make use of, and even our faculty can use of. So, an interesting details of this article is found in the source that I have shown in the slide. Another article is on a digital mental health solution to improve social, emotional, and learning skills for youth like you. There is a protocol for an efficacy and usability study. So it is available in the screen, the source reflected in the screen from GMIR Publications Advancing Digital Health and Open Services. And then lastly, mental health and digital technologies. So these are a lot of literature reviews that highlights digital mental health for young people, sustainably managing stress and anxiety. All right. So hopefully, you will be able to visit this article and read and ponder upon on this in volume 2, issue 3, October 29 as of 2029 on um, Emerald Publishings. Okay? So this is now our future direction of mental health care using simple digital approaches that involves the following. We need to integrate accessibility and use of personalized tools. And that into existing care models that we are using, we are actually having a lot of nursing theories. We can revisit them, and maybe we can integrate, and we can actually make use of certain personal tools aligned with the nursing theories that we are using in our care models, and that we improve early intervention. We also expand access, very important, especially for remote areas, and offer continuous support. So key trends focus on blending human experience. All right. There is a need for human expertise and with technology to create a more efficient and patient-centric system. It cannot only be the robot, it cannot only be the chatbot, but there is someone, a nurse, who is adept and competent in blending human experience, expertise and technology that will be helpful in fulfilling the objectives and the goal of healthcare in our area. So with that, I thank you for listening, and I am now ready for an interaction. If you have some clarification with the material I have shared, we can actually have a dialogue as of this moment. Thank you very much.
Thank you very much to our Dr. Neil Martin for your insightful, inspiring, and deeply meaningful presentation. Now we will proceed to our Q&A session, for which we have 5 minutes. If you have any question, please raise your hand. For participants joining us via Zoom, you may type your question via chat box.
Okay, sir. Let me introduce myself. My name is Angelina Ahmadi from the University of Health Sciences, Cimahi. And almost 2 months ago, I went to Philippines for student exchange program, and I found
Wow.
out that in Yes, I went to Philippines, and then I found out that in Philippines, using AI and the other technologies are really good for every assessment there. But we know
Mm-mm.
that there are a lot of risks of using technology such as security data of patients. So,
Mm.
if we use AI or another technologies for patients, how
Right.
to keep patient secrets during the mental health assessment, and also how to ensure the patients or giving any guarantee for them believing us of using the apps that your data will be safe. And then the second question maybe is, in these eras, not every people
Mm.
care about mental health, and some of them are
Mm.
using AI for being friend instead of human or talk with human. So what if
Mm-hmm.
it be addictive for them and they become a person who don't believe human anymore? Is it it could be a mental disorder, and how to solve it in this technologies era? Thank you.
All right. I'm sorry I didn't get the last few sentences, but I hope I got it right. And I am happy that you're able to visit Philippines. Okay, so I want to know where in the Philippines you have visited, because at any rate, that's a good observation. And then, very important for us future nurses is to really be grounded on our use of therapeutic self. Other than the use of therapeutic self is to be able to use the therapeutic communication techniques. All right. Remember, very important in the tequila framework, number one is trust. All right. So with trust, it's very important. You cannot just have the trust of our patient immediately. Okay. Especially for those who are having mental disorders. They are seeing you with the characteristics of being paranoid, and so it's so hard for us to really build trust to our patients. Nevertheless, with the presence that you are actually showing to them that is genuine, all right? It could be very hard to really measure genuineness of our intention. But you see, with our patients that are having mental illness and mental disorders, it would be very hard for them to trust. Therefore, you make it a point that you really have to establish that trust. You have to be patient and you have to be courageous enough, because if you fear, then you will also they would also feel that you have fear in you, right? So when fear begets fear, then that's really a barrier in the nurse patient professional relationship. Okay, so I hope that's clear. And with regards to AI, in terms of privacy, uh, yeah, I mentioned that you have to be very ethical about it, and as much as possible, it has something to do with the kind of system that the hospital or the university are using, particularly on technical aspects, by which it should not be accessible to all. All right. When there are existing systems, there has to be some forms of passwords and then some other items for proper repository. And it's not a matter of, presenting it publicly. Because at any rate, in the Philippines, we're also observing so keenly about data privacy law. So, with the data privacy law, there are stipulations that it is the responsibility of the healthcare practitioners on confidentiality and privacy. So, we have to ensure that. And say, for example, in doing research, that we have to ask permission or we have to ask or secure consent for our patients or our respondents or our participants of the study or the institution where we are conducting the study, because other stipulation of our letter or like intent to conduct the study, we have to let them know the whole processes of what we will be doing so that we can actually see transparency at our end, and they are aware and that they have been given an option to stop at any time. And then if they don't want to pursue with the study, then it is all right, and they are not coerced and they are not being penalized. Okay, so helpful is digitalization, because in the data we can also do um, the repository of our data, and that it's very helpful. Like, say, for example, big data, you have a lot of data, so make sure that it is safe, and you've got to be more of keen in establishing the system, not to expose, not to make it public. All right. And in fact, in the diagnosis internationally, we do not already use clear diagnosis by full word, it is by code. All right. So coding is also very important as part of the system that will prevent the risk of spreading information to the people that does not need those information, and that will cause us a breach of our contract with our patients, with our participants of the study, and the clientele that we are serving. Okay, I hope that is clear enough for the query, and I hope to see you again in the Philippines. I am inviting you to join us in the Mindanao side, because I don't know where in the Philippines you have been to last week for your exposure here. Maybe in Manila, or
Yes, in
yeah, where in Manila?
in Central Escolar University and Manila Central University.
Ah, I know that place. Okay, yeah, in Manila. So, wow, it's really an honor that you have been in Manila. So maybe you can go down next time to Visayas and Mindanao, because we are actually down south. And hopefully you'll be able to appreciate more of what Philippine nursing is in terms of caring for our patients, and then maybe like relate and resonate with how Indonesians do care for patients as well. I think we've got similarities. Okay?
Okay, thank you. I really hope to.
All right. So, yeah, good question. Mantap.
Thank you very much, Dr. Neil M. Martin and the participant. Maybe one question again from the participant.
All right, please.
Okay, doctor. Let me introduce
Hello.
myself. Hello. Let me introduce myself. My name is Nursipa Parwati. I have one question for you. May I?
Yeah, sure, please. And thank you very much.
Okay. What is the main practical challenge for a student who decide to use one of the 50,000 available mHealth apps for psychosocial well-being, considering the effectiveness statistics side in the presentation? Thank you.
Mm-hmm. All right, very good. Thank you very much. So that is a very nice, very impactful question. It's really good that you're able to ask that question, because at any rate, that's the reason why it's very important. And I congratulate the organizers of this webinar, because you are now telling the whole world that each of you would like to develop the knowledge, the skills, and the value and attitude, as well as the life skills that is necessary for you to be prepared to do care for your patients. So basically, you need to know how the platform works. Okay, very important. Because if you have to know the platform and its features, then definitely you'll be able to explore how to use it, especially when you use it with the patient. Okay, especially when you do use a certain platform to communicate to your patients that are in the remote area. So if you make sure that your patient also is available or accessible through online maybe, so that you'll be able to develop certain skills at their end. Other than your knowledge, other than your skills, is you also share your knowledge and skills to your patients, and the value of why you have to do it. Because if they do not understand why you're doing it, then definitely there would be no cooperation, or there will be less cooperation, and that you will fail to meet the objectives and goals of your care. All right. So,
Right.
other than that, we do not rely. We cannot actually replace human care to these applications or these robotics or digital applications or health applications, but rather we make use of this to enhance, all right, to enhance our care, especially when there are few nurses and more patients. So definitely, it helps a lot when we have this health applications that will be helpful to provide care to our clientele. All right. I hope that's clear and you're satisfied. I have answered your questions. Have I?
Yes.
All right. So thank you very much.
Okay, thank you, doctor.
All right. All the best to you.
All right. Based on the material presented by Dr. Neil M. Martin, we can conclude that effective self-care strategies such as regular physical activity, health nutrition, adequate sleep, stress reduction activities, gratitude practice, and goal settings that can significantly improve mental well-being.
Yes, that's exactly well said, Miss Moderator.
Thank you. Thank you once again, Dr. Neil M. Martin, for your valuable contribution and for sharing such a meaningful insight for all of us today. Before we officially conclude this session, Stika PPNI Jawa Barat would like to present a certificate of appreciation and invite Dr. Neil M. Martin to join us for a group photo session as a part of our documentation. All right, this is for the certificate, Doctor.
Yes, thank you very much.
All right, to all participants, thank you for your attention, enthusiasm, and active participation. At this time, I would like to respectfully return to the floor to our Master of Ceremony to proceed with the next agenda. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Dr. Neil Martin for the inspiring presentation, and thank you to Liliana for the session. Ladies and gentlemen, have now reached our final lecture session delivered by Dr. Siwan Chule, who will be sharing her expertise on PBRI model for primary care, technology approach for NCD prevention in action, Thailand. This session will be moderated by Tiara Ciela. Before beginning, please allow me to read her curriculum vitae. Tiara Silanjani, she is a third-year nursing student at STIKO PPNI Jawa Barat.
actively involved in student activities, community service, technology-based projects, and health education programs. Her achievement is being International Student Activity Boro Marajonani College of Nursing Noparat Fajira, Thailand at 2025 is being Technology Innovation Student Creativity Program Social Humanities Research at 2025. For my beloved friend Tiara Sela, the floor is yours.
Thank you, Master of Ceremony, for the warm welcome. Good afternoon. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, and greetings of virtue. Peace be upon us all. Distinguished guests, respected speaker, and esteemed participant, we will now proceed to Lecture 6 of the 2025 International Symposium. My name is Tiara Sila Anjani, and I have the honor to serving you as moderator for this session. Ladies and gentlemen, it is my great pleasure to introduce our esteemed speaker, Dr. Siriwan Tamchea, PhD, who currently serves as the Deputy Director of Research and Academic Service from BCNS, Faculty of Nursing, Poro Baro Marajanok, Thailand. Allow me to briefly present her curriculum vitae. Educational background. Dr. Siriwan, Dr. of Philosophy in Nursing International Program at Tapsat University in 2018 to 2023. Short course training in nursing specialty midwifery in 2015. Research focus on telenursing, teenage pregnancy, repeated pregnancy, individual and family self-management, health belief model, and maternal and child health. Recent publication. Strategy to prevent repeated pregnancy among adolescents in 2021. A pack of program promoting sexual literacy and sexual deletion tendency on self-protection from families needs to prevent repeated adolescent pregnancy in 2025. Any further ado, we will begin. Before we proceed, Achan Siriwan, can you hear me clearly?
Good afternoon.
Good afternoon, Achan. How are you doing?
Thank you so much for introducing myself. And I hear you, but I'm not sure you can hear me.
We can hear you clearly, Achan.
Okay, thank you.
Before we proceed, Achan, I would like to explain the time allocation for the session.
Okay.
This session consists 45 minutes presentation and question and answer segment later. Achan, you may now start your presentation.
Yes. Can you share my screen or I can have can you share my presentation slide? Can you?
Okay, Achan.
Okay, I can share by myself. Just a minute. Can you see this PowerPoint?
Yes, Achan.
I'm not sure this slide is from your screen or my screen. I think from your screen, right? Or not? Okay, thank you. So sorry. Okay, this is my screen, right? Can you see?
Achan, can you zoom the presentation?
I'm not sure for the move for the next slide.
Yes.
Okay, can you see this the next slide?
Yes, Achan, we can see.
Okay, I would like to start for the first slide. Okay, this is the topic. Okay, first of all, I would like to thank you, Tira Shela, for introducing myself and my study.
Achan,
So,
part the screen.
oh, sorry.
Yeah.
Okay. Uh, okay. First of all, I would like to talk about the philosophy, the topic for today, because before we come to the topic in the detail, I would like to share the topic of PBRI model for primary care, the technology approach for NCD prevention in action in Thailand. First of all, I would like to mention the educational philosophy of PBRI. The philosophy of PBRI is very important because the PBRI is a health education institution to support the Ministry of Public Health in Thailand. So the philosophy is to emphasize uh, diverse experimentation learning with a learner-centered approach grounded in the concept of pragmatism to cultivate graduates to be lifelong learner, process moral integrity, demonstrate competency in primary health care, and be capable of working collaborative with a multidisciplinary team to promote sustainable community well-being. That you can see that from the philosophy, we need to manage and integrate the PBRI into our curriculum so that for the PBRI model, it means an integrated of higher education mission into the development of the primary care system in Thailand to enhance the quality of life for people in the community through a primary healthcare approach. For example, screening or surveillance and the prevention of communicable and communicable or non-communicable chronic disease using the seven color traffic ping pong tool or uh, 3ES or 3RS activity is the principle related to health promotion, disease prevention, medical treatment, and rehabilitation to prevent the complication of many diseases. And community-based model grounded in learning that emphasize local wisdom, interdisciplinary integration, partnership building, and active community participation for overall community well-being. And the last is the collaboration with other sectors, such as religious and educational institution and sector. So the PBRI model have to implement and integrate in the curriculum. But how PBRI integrate PHC in the curriculum because the PBRI model cannot stand alone. It have integrated with the primary healthcare in education. We hope that the student, especially the student nurse from our college or from our faculty of nursing, after they graduate, they can have the identity of PBRI graduates who are critical thinker, communicator, collaborator, and creator. So students' competency aim to community well-being following years learning outcome. We call YLO. For example, the first year they can have self-care. The second year they can care for the other person. The third year they can work with the community, and the fourth year they can work as a team leader to manage community health. So the community-based learning is very, very important to emphasize local wisdom and integrated with the community interdisciplinary integration, partnership building, and active community participation for overall community well-being. As we know that for the NCD or the non-communicable disease is high prevalence worldwide and including technology disruption in this era. So we can have to find the solution for health prevention and promotion according to our philosophy of our institution. Therefore, our college integrated PBRI with the technology such as telenursing. Because we are nurse, so we use telenursing as the innovation for us to find out the solution for the NCD. This innovation consists of primary care, or is called primary health care through primary care or primary care through primary health care, and telenursing and PBRI model. These three components is very important, serve as the backbone of this innovation for nursing technology in our college. For the PHC, consists of five C. The first one is first contact. The second is comprehensive and coordination, continuity, and patient-centered care. In addition, we include community-based education at health center because our college have a partnership with health center or 30 college around country have partnership. At least one health center is a partnership. So for the telenursing is the use of telecommunication technology to deliver nursing services and conduct nursing practice across distance. And for the PBRI model is the student trained to manage a wide range of common conditions and provide comprehensive service. And the students are trained to work coordinately with the people in the community and health profession. And students are trained to care for the people to their lifespan from antenatal to the end of life care. And students are trained to care for person in holistic approach and care for people as a whole community. So for the primary health care is the definition is the essential healthcare based on scientifically sound and socially acceptable method and technology. The key component of the primary healthcare is the first one is universal coverage, is healthcare for all, and people center is focused on individual and community needs. Comprehensive care is mean to prevention, promotion, treatment, and rehabilitation. Coordinate care is mean to integrate across level and sector, and quality and safety is mean to evidence-based safe practice. For the primary healthcare component for the NCD is very important because when we deep in this component, we found that it consists of health promotion and disease prevention, early detection and screening, and in addition, we have to treatment and management, and the last is the rehabilitation and palliative care. For the core component of telenursing is consists of remote monitoring about symptom, medication or medication adherence, patient education for them to do self-management or lifestyle modification for health education. The care coordination is mean communication with the healthcare team and critical assessment, virtual consultant, and follow-up care is mean to the continue monitoring and support. For the technology platform, as we know that we have many technology that we can use, but if we select the platform that fairly use and popular use for the patient is okay for us to handle the telenursing. So we select the mobile health application for health education for them to have a self-management of the NCD patient because mobile applications such as Line application is popular used in Thailand. And for this topic is very important about the multidisciplinary team approach because nurse cannot stand alone in the healthcare team, so that we have a partner. Key teams member is consists of the primary care physician. So the role of the physician is diagnosis, treatment decision, and nurse for the care coordination and patient education and monitoring about the clinical of the patient. The pharmacist, the role of pharmacist is medication management, adherence counseling, and in addition, we have to lead the nutritionist or dentist to consult for the diet consult or for the teeth consult, and social worker. This group they serve as a psychosocial support in the resource coordination in in the in the context, and the community health worker. For this group, they serve as a local support and advocacy, and sometimes we need the specialty such as the cardiologist or endocrinologist for consulting. For the multidisciplinary care team aim at to have a collaborative care model benefit because those were comprehensive assessment and planning and improve patient outcome, enhance care coordination, and they can get the better resource utilization and reduce healthcare costs. So when we consider the integrated between PBRI model and the telenursing and primary healthcare component is very significant, and we can use this concept for develop the solution to try out and figure out the NCD in the health station of us. So the first thing is the identity target population. We use the ping pong 7 color to identify the population or the sample to the group up to the color of them, and we can choose them to color green or yellow or red color up to the health status of them. And the networking building, we choose to have the it seems like the MOU with the health station of us to establish the partnership between the healthcare facility. If we cannot have the MOU, it means to be we have to set the goal together to take care the patient in that context and technology infrastructure. So as I mentioned, I selected the mobile health application and education and training. Our staff and our students have to learn and have to familiar with the telenursing protocol for use and the guideline and protocol. We use the principle of PBRI model. There are 3 TRS activity and resource allocation. We have to human resource planning for this project and assessment and monitoring. We have to check for the patient satisfaction survey for the when we use this technology. That maybe is the new thing for them, or for the patient, or for the healthcare provider, or for the social worker. They can have to I mean that they choose to training and the maintenance protocol, and in the last one is the patient engagement program. Okay, this slide I would like to show you the model of telenursing system on diabetes patient care in primary care services. According to the concept of PBRI model and 5C, this project is not the research. It might be the research in the next coming year. And the first one is the first contact. This concept will follow the PBRI model and primary care. First contact through the line OA or the line group, and then we have to use the comprehensive. Comprehensive is mean to prevention, promotion, or treatment, and continuing pre-hospital, in hospital, and post-hospital, or pre-health station, in health station, or post-health station tool application is line OA or line group, and collaboration, the multidisciplinary care team. For example, in this study, I conduct with the we cooperation with the nutrition for the DM patient, and patient center is DM patient. So this is the result of this project. We implement telenursing as a strategy for managing blood sugar level in 25 diabetes patients. This approach aligns with the primary health care. For primary care, considering that many patients work as uh, the milker in the early morning, this the population in this health station responsibility, they work as the milker, so they have to early morning work, and it's difficult to take the medication before the meal. So additionally, the community is located far from the city. It's about one 100 kilometers from Sระบุรีprovince. And in addition, they have a complicated access to health care through telenursing and health education focusing on the 3ES and 3RS activity. We emphasize the knowledge and attitude for effective blood sugar control. As a result, for study, we found that 23 out of the 25 participants experience a decrease in their blood sugar level. This is the outcome and impact. Can you see this picture is show about the 7 color ping pong or ping pong ball 7 color, but for our community we have milker, so that we use a cow as the symbol of the ping pong. In the 2024, the project start by utilizing telenursing. And this year, we developed for the line OA. Can you see the next slide? This is the new one of the technology approach, same as the telenursing. We use the official lines as a application for health education with the NCD patient at the Sirikit Health Center. And for this application to promote health and prevent health problem and provide integrated care to diabetic patient who cannot control their blood sugar level with the power of the multidisciplinary professional, and develop an integrated diabetes care system with the multidisciplinary care team. Can you see that this line when the patient to select as the ping pong as yellow color or red color, we have to screen in the first time that we call first contact. So when the diabetes patient come to the health station, we have to check and let them to scan the line official to health education. The next slide is if you see that these pictures show the 7 color ping pong have to screen health of them or health check up, and then we divided them up to the color of the ping pong. And this PBRI model, we have 3S and 3E. That is the principle to manage, such as the food, the exercise, or the emotion, and activities such as the exercise. The patient have to exercise or not, or the TS TTR is mean to the alcohol and tobacco or obesity, and 3S and 3R activity. And for the next slide, I will show you that for this, can you see on the screen? We show the self-assessment form. Not form that. It's mean to the activity that they can do during they have blood sugar level cannot control. And then we have the media to show the health education, or they can access to the clip video or the media or the manual for health education. And in addition, we have to follow up on the appointment with the healthcare provider, and they can set up, and this is the PBRI, is the self-care for them. They can scan and read the knowledge, or can access to the manual or the how to do or how to manage the health during they use this technology or this tool via the line application. And in addition, we have contact through the line with the chat or telephone, or that up to the patient need to contact with the healthcare provider. And expected outcome is very important, because have to do for the control the blood sugar level or the quality of life with the DM patient. We expected that if they use if we use this through or this technology, we can have the modern care support tool that combine traditional knowledge and the technology. And in addition, we have the effective coordination between profession, because we can have the physician or the nutrition, something like that they can let them to our application. And there are adequate resource to care for the patient, because the health station is far from the city, so that the technology can solve and reduce long time treatment costs, because we have consulting at the all time or immediately that if the patient need. Integrated diabetes education is provided through Line OA and enhance exchange knowledge between profession, create a cooperational network, and the team is skilled and work together well. In addition, patients receive complete care and one-stop service via Line OA, and reduce complication for diabetes and have accurate and current information to plan and care effectively. So that we expected that this technology can help us to take care of the patient, especially for NCD or uh, DM patient, to have a quality of life in the future. So maybe next time I will uh, present you for the result of this study, because this is a project, and then we during the develop the tool for the next time. Thank you so much.
You're welcome. Thank you, Dr. Siriwan, for the insightful presentation. We will now proceed to the question and answer session. For participants who wish to ask a question, you may raise your hand, and for participants joining via Zoom, you may submit your question to the chat feature.
Okay, let me introduce myself. My name is Salsa Triapsari. I have a question for you. What challenge do students usually face when applying the PBRA model in the community?
Again,
Thank you.
please. Sheila, would you please to repeat the question again?
Oh, okay. What challenge do students usually face
challenge?
when applying the PBRA model in the community?
I think the challenge of the PRI model in the community is the mindset of the people and the student and the healthcare team to understand and to set the goal to work together, and for the uh, that to take care the patient in the same way. Yes.
Okay, thank you.
Thank you so much for the question.
We will now moving to the last question.
Okay, thank you for the opportunity. First of all, let me introduce myself. My name is Ramadina Rizkia. I'm from Education Indonesian University, or we can call it Universitas Pendidikan Indonesia. The question I want to ask is about how can we ensure that digital innovations within the PBRI model remain sustainable and not dependent on short-term funding or pilot project momentum? Thank you.
I think maybe in the future. Maybe in the future.
Slowly.
Okay. How can we ensure that digital innovation within the PBRI model remains sustainable and not dependent on short-term funding or pilot project momentum? Thank you.
I think this project is just established to sustainable for the for take care the patient. It's just not the short time. It just have to make let policy of the PBRI or policy of the public the Ministry of Public Health to work together, and then they have to work and they have to join for the sustainable, not is the short term. I think is the policy is very important.
Okay, thank you.
Thank you so much for the question.
Thank you so much for Dr. Siriwan for the thoughtful response and the participants. Allow me to conclude this session. The PBRI model integrates higher education and technologies with Thailand primary care system via PHE approach using tools like 7-color models, community learning and collaboration, and the LOA to prevent and manage NCDs. Before we openly close this agenda, Sticker PPNI Jabar will present a certificate of appreciation followed by group photo session.
Thank you so much for giving me chance to share our studies for you.
Achan, I would like to close our session today.
Okay, thank you so much. I can leave Zoom now. Thank you.
Yeah.
Bye bye.
Achan. Thank you for all participants for your attention and active engagement. I'm moderator and I'll be leaving now. Wassalamualaikum warahmatullahi wabarakatuh. I now return the session to our master ceremony.